Good morning. Welcome to day 3 of our Couch to Couch conference. We're glad that you're here. This morning's guest is a gerontological and family nurse practitioner with a background in comprehensive family-focused care of people with dementia, advanced care planning, and geriatric care management, and also serves on our board of directors. Please welcome Nansi Greger-Holt.
All right, so I did not get that loaded, so if you want to load it, can you have that?
Okay. That's fine. Give me just a sec. Let me pull up the right window because I've got too many things.
Well, actually, let me just try one more thing. I'm sorry, you guys.
That's fine. This is all. I've got it here if you want me to go ahead and run it. You want me to run it?
Yeah, go ahead. Just
Sure.
that I don't find it.
It's thinking about it. There we go.
Okay. So, is it clear on your end? Because it's kind of fuzzy on my end. Is it clear for everybody, or is it just that it's loading or something?
I don't know what it looks like on everyone else's.
Okay.
It's kind of fuzzy.
Kind of fuzzy.
Yeah, it's not, it's like it's pixelated, Krista.
Oh,
Yeah.
I don't know why that would be. Let me
Yeah.
stop and restart.
Let me try something else.
If I could try again. Let me try again.
I'm on a, yeah, thank you.
Is that any better?
Some, not completely clear, but better.
Okay.
Let me just do one more thing, see if I can get mine up and see if it'll be any clearer, because it's going from me to you. I don't know if it'll make a difference.
All right, I'll stop sharing then.
Okay. Sorry, you guys.
It's okay.
This is
So while we're doing this, everybody take a nice big deep breath and exhale out. Let's do that again. Inhale and exhale. Very nice. Makes such a huge difference when we relax.
And I wondered too, though, if I switch the spotlight over to myself, maybe that will make it better. Let me try it one more time on my end. And then if not, then we can, how's that?
That's better.
Oh, perfect.
There we go. All right.
See what a team effort it is.
Then they get to see you too. I'm like, yeah, that's kind of a. I am so sorry. Wait, let me just look. One more try. I'm just trying one more thing.
Well, if you want me to, I'll have to stop sharing if you want to share.
No, I haven't done it yet. So you can go ahead and keep sharing until I figure out how to get this.
Well, did you want to just?
Aha, I found it. All right, let's see if that'll work.
You want me to stop?
Let me see if I can download this and see if it'll open.
So you're not going to be able to share it while I'm sharing.
All right, let me, you don't have to share now.
Okay.
Start.
False alarm, everyone.
Okay, now let me go to the Zoom thing and do my share. Okay. Share screen. There. Yeah, how'd I do?
Yay! Happy dance.
And this is why nobody should worry that they're not sure how to use Zoom, because we're all figuring it out. So it's all good.
I'm sorry, I just wasn't really thinking.
No, you're good. You're great. It's doing great.
But thank you guys for inviting me. I'll tell you a little bit about myself. So I'm a family and a geriatric nurse practitioner. I work at UNC in neurology in dementia care. So that's what I mainly do. I also have worked in hospice care and lots of other ICU care. So I've been a nurse for, let me think, 42 years. I started when I was 10, because I know, you don't want to think I'm that old. And then I've been a nurse practitioner since 1996, how many years that is. Advanced care planning is something that's really near and dear to my heart, because I spent a lot of time in my life working 30 years in the ICU at Duke with people that were very, very sick and dying. And that medical ICU at Duke is the dietist place, I would say, at Duke, because when people are very, very sick and they are able to throw all that they can at the patients to help them try to survive, they end up in the medical ICU. And I always thought it was the die in his place, but I never really knew. And years ago, they were trying to get people to call the organ procurement agency when somebody passed away, so that they could ask the family if they could donate their organs. Because if staff asked, we didn't do it the right way. So they kept a log of all the people that died in the hospital, how many died in each unit. And so then I got to see how many people died every month in each unit. And in the emergency room, they had about 8 people die a month. And in the medical ICU, on average, we had about 30 people die a month. So then I thought, oh, that's right. And then when I learned about coronavirus, unfortunately, I think 80% of people that end up on ventilators, and that's what the medical ICU does, it's like the respiratory, 80% of people that end up on ventilators with coronavirus don't survive. So I thought, well, that's really, really high. So then I looked up on average normal people on ventilators, and only 50% survive, which really was surprising to me, because if I had known only half of my patients were going to make it out, I would have thought differently about it in a way. I mean, I still would have done my care, but it just really makes you think. So anyways, so advanced care planning and end-of-life decision-making. So when we talk about the reason that it's become such an important topic is because we can do a lot in managing people, and the way that the medical progress has changed the way we live. It's changed the way we are sick. It changed the way we die. And having worked in the medical ICU for so many years, I started in '78. I left there about 5 years ago. I saw a lot of changes in the way into technology, and we can keep bodies alive for a long time without much quality. So this book on the bottom that I'm talking about, Being Mortal by Atul Gawande, I don't know if you want to raise your hand if anybody's heard of it, but he's a physician, and you might have seen him talking. He has been talking some on TV. So he's a physician, a surgeon who's written about end-of-life care in the United States. And often we do much more aggressive care despite the chance of survival. So that's why he talks about this, so that we should all have an opportunity to make decisions about what we want at our end of life. So the medical, legal, ethical issues started back in the times with these couple women, Karen Ann Quinlan and Nansi Cruzan. So Karen Ann Quinlan was a young woman who had a combination of, I think, diet, pills, and alcohol, and she went into a coma. And there was controversy between her family about whether or not to keep her on life support. The life support she was on was a feeding tube. And similar, Nansi Cruzan had a car accident and was in a vegetative state as well. So the year 1975 was the year that Karen Ann Quinlan went into a vegetative state. And the year 1985 is when she died. So she was kept alive for 10 years by medical technology while being in a vegetative state. So in 1990, they developed the Patient Self-Determination Act, and that's when advanced directives became something that people can do. So it's not that before that, people just thought you do what your doctor tells you to do, and you don't really have a choice. So I'm going to explain a little bit about that. I have a video here, so let me see if I can click on this video. Okie dokie, let's see that.
You might have to reshare the part of the screen that has the video, or I can pull up that slide and show it right within. It's up to you.
No. Let me see. Wait a minute. All right. Let's do that. Here we go. Is that working?
January 11th, 1983. On a cold, wintry night in southwest Missouri,
Is that working, Jackie?
I want to quickly review.
No, it's not showing your video. Do you have a video screen that opened?
On many of our intimate decisions. But what about one of the most...
Say it again.
Is there a video screen that opened maybe on the bottom somewhere?
1986, the Supreme Court had a...
Okay, let me try again. A video screen that opens on the bottom.
Just somewhere. Chris, are you there?
Yeah, you
Do you want to find
Yeah,
my-
I actually have the slide with the, I went ahead and embedded the video into the slide. So I'm going to stop yours just for a second and then we'll hop
great.
over to mine.
Okay. And there's a part where I need to end the video. I think it's, and I'll just sort of raise my hand when I want you to end it. Okay.
Okay, or just shout at me. All right, so hang on. We'll get there.
Okay.
Should be in here.
Oh, I see what you did. Okay.
January 11th, 1983. On a cold, wintry night in southwest Missouri, 25-year-old Nancy Cruzan drove home down a lonely country road after working the late shift at a nearby factory. Suddenly, she lost control of her car, which crashed into a fence and overturned. She was thrown from the car and landed face down in a water-filled ditch. When the State Highway Patrol found her, Nancy had no vital signs. However, paramedics arrived and managed to restore her heartbeat and breathing. After a few weeks in a coma, Nancy opened her eyes, but did not exhibit awareness of her.
Oops, sorry. I didn't mean to go backward here.
Are you playing around?
Well, I was trying to like get rid of that one. My goodness, I want to go
You're
back.
going the wrong way. Yeah, go back again.
Hold on, I'm gonna stop sharing and get to where it was.
Okay.
Hold on.
So it was hard to find a good video to explain this. And the reason, but I really like this video because it really just kind of tells the story and talks about the whole chronology of developing the advanced directives.
Okay, let me get back to it. I tell you what, it's really finicky when you're sharing from Zoom because it's really touchy when you click through. So
Okay.
I'll try to skip ahead a little bit.
Okay.
Home down a lonely country road after working the late shift at a nearby factory. Suddenly, she lost control of her car, which crashed into a fence and overturned. She was thrown from the car and landed face down in a water-filled ditch. When the State Highway Patrol found her, Nancy had no vital signs. However, paramedics arrived and managed to restore her heartbeat and breathing. After a few weeks in a coma, Nancy opened her eyes, but did not exhibit awareness of her surroundings. Doctors diagnosed her as being in a persistent vegetative state, and a feeding tube was inserted to provide long-term care. With it, she could live for years. Without it, she would die. After waiting 4 years for her condition to improve, Nancy's parents, Joe and Joyce Cruzan, gave up hope and requested that the feeding tube be removed. The hospital refused to do so without a court order. The Missouri Supreme Court ruled that the feeding tube had to stay in place unless Nancy had left clear and convincing evidence that she would not want to be artificially fed in such a situation. The case was appealed to the United States Supreme Court. In response to Nancy's trial, the American Supreme Court, led by Chief Justice William Rehnquist, established for the first time that any competent person has a constitutional right to refuse medical treatment. And in this regard, artificial nutrition should be considered the same as any other medical treatment. Still, regarding Nancy Cruzan, the Supreme Court upheld the ruling of the Missouri court because there was no clear and convincing evidence that Nancy Cruzan wanted to exercise this right. However, the family later provided evidence that Nancy would have wanted her life support terminated and won a court order to have the feeding tube removed. Nancy Cruzan died 11 days later on December 26, 1990, almost 8 years after her accident. Nancy Cruzan's tragic story and the subsequent litigation process underscores how important it is for a person to issue advanced medical directives specifying how they want to be treated should they be unable to make an informed decision. But how does one do so in a way that is informed by Jewish law?
Is that
We're
good?
good.
Okay.
So I found that just online and it was some kind of Jewish something. So that's why I just want to stop that part.
Very
So and you got share my screen now.
Yes.
Okay.
Oh, I could go
Yeah.
back. I just figured that way you have control again.
Did I do it? Yeah. Okay, great. So if you look on her tombstone, it says that she departed in 1983, and then she was at peace in 1990. And this is like an EKG. I really think that was really beautiful. And it says, thank you. So when it talks about people dying, I talk about this topic a lot, and people say, well, if I die, I say, well, you're going to die. So we're all going to die. So 85% of people will die from these chronic illnesses, cancer, organ failure, and neurodegenerative diseases and frailties. So the 40% of the neurodegenerative diseases, a lot of that is dementia. And that's why in my practice, I talk about advanced directives all the time with my patients, because I want to hope that they can make decisions and complete documents before they get to a point where they are not able to anymore. Because as the disease progresses, they lose their capacity to understand the ramifications of any decisions that they make. So on average, it takes 2 to 4 years of disability before people die for these 85% of people. The other 15% of people, I think, is that they die from like automobile accidents or heart attack. So 85% of us will have a long dying. I always would say to people that my patients, and in discussion with this, I always told them that I wanted to live until I die, meaning that I didn't want to spend a whole lot of time dying. And I recently had a friend die, and he felt the same way. We talked about this a lot, and often we can't control that, but that's kind of how I feel. And I don't know, I think most people don't want to spend a long time dying. So when people are sick, or before people even get sick, but when people are sick, it's important to talk about goals of care. And goals will change when depending on your illness. And it's important to talk about these goals when the person is, often the discussion is, well, what happens if you get sicker? Or what's important? Or how do you want to spend your time? What's scary to you? What does comfort care mean to you? And when people are very sick, in trying to make any decision about medical interventions, if you try to think about what are the goals, it's easier for you to make your decisions. For instance, say a person is in a nursing home and they fall and bump their head and they have to go into the hospital, and they say they have something wrong in their brain and they're going to have surgery. Well, say that person doesn't really have much quality of life, that they really don't know their family. They're scared being in a place like a hospital, especially now because people can't have visitors. Even before, when people could have visitors, if you weren't going to stay with your loved one all the time, it was very difficult. So you might make a different decision depending on somebody with illness as you would if somebody with health. So if somebody was healthy and they have like blood on their brain, they might do surgery on them. But somebody who's very sick and had advanced dementia, you could do the surgery, but it wasn't going to fix the dementia, and they weren't going to get any better from that. And something like a brain surgery would probably set them back physically anyways. So then you make a different decision. And so it's important that people, and it's somebody's own opinion. It's their family's opinion. It's their loved one's opinion. So that's why it's really important to think about your goals of care. So advanced directives are a way that you talk about what your goals of care are in advance. Like I just had a patient yesterday say, I said, do you have advanced directives? He goes, well, and he had dementia. He had some Parkinson's disease. There's a question. What happens when somebody dies from dementia versus a stroke? So what happened here? So dying from dementia is a long process. So usually, hopefully, the way I see my patients, and when I talk to families, hopefully people don't die from they die from their dementia, but some other event causes their death, like pneumonia or a heart attack. People that die from dementia, if they die from dementia and you've been treating all their medical issues up to that point, then what it looks like when somebody dies from dementia is they're in the bed, not able to talk, not able to communicate, not able to really eat. And even if you didn't have a feeding tube, they would have swallowing problems and they would develop pneumonia and they would die. So hopefully, and that's why we have advanced directives, is you could make a decision about how aggressive you want your care at the end of life, and as well as making goals of care. So, I'm going to continue and explain that. So these are people doing their advanced directives, and this is my mother-in-law, and this is my father-in-law, and this is my aunt-in-law. So actually, she died in September this past year, and he died in January. She had heart failure. He had some heart disease, but I'm convinced he died of a broken heart. And just happens that one day they live in Pennsylvania, and he always wants to give me things. So he got this thing, it's called the Vial of Life. It's this plastic tube, and you're supposed to put your advanced directives in it, stick it in your freezer. And so he says, yeah, look what I got, all these things. You know, he picks them up at fairs like some of us do. And I said, well, that's Pennsylvania advanced directives. I don't need them because I don't live in Pennsylvania. And I said, you know, this is what you guys should have. I said, what, you have advanced directives? He goes, yeah. I said, well, what do they say? He said, I don't know. I said, where are they? He said, I don't know. So we sat down and we did advanced directives. And it just happened that it was just like, oh my gosh, it was just a picture. So I took their picture. So it wasn't planned. There's nothing that we can, nothing predictable except death and taxes. So the National Healthcare Decision-Making Day is actually April 16th, because the day after taxes. But actually yesterday, July 16th, because tax day was really July 15th this year. Actually, yesterday was the National Healthcare Decision-Making Day. I don't know if anybody had never noticed that. We were going to do a talk on national healthcare decision-making in April. We planned a little conference, but that got canceled because of the pandemic. So here's some myths about advanced directives. Only old people need advanced directives. That's a myth. We all need advanced directives because we never know what's going to happen. And that being said, I have my advanced directives. My husband has advanced directives. I've been trying to get my kids to get their advanced directives. I've given them blanks. They haven't completed them. And so it came to this revelation came to me like after Mother's Day. I should have asked for it for Mother's Day, but it happened after Mother's Day. I said, what I want for my birthday, which is September, is I want a copy of your advanced directives that are signed and notarized. That's all I want. So that's the only way I'm going to get them. And I think I'll get them because I told them what I want. So that's a myth that only old people need advanced directives. The other myth is my doctor, my family already know what I want. Unless you talk to them about it, they don't know what you want. And lots of doctors think that their purpose is to prolong life, whereas lots of people think that they don't want their life prolonged if they don't have good quality based on their health. Advanced care planning costs a lot of money. That's a myth as well. And Chris, did you send out the documents? I'm not sure, but that was a handout that we had.
Yeah, I did this morning.
And we could either show them or you can email them to the participants if they want.
Yeah, I sent them
Is there a way to do that?
Yeah, I sent them out this morning.
Yeah, we don't need to show them yet, but so they don't cost a lot of money. All they cost is you print out the document, you complete them, and you go get it notarized and witnessed. It usually can do that at the bank. You don't have to bring your own witnesses, and so it shouldn't cost you anything. And advanced directives mean I'll get worse treatment. No, the advanced directives can only come into play for certain conditions, and it's clear on the advanced directives when they come into play. This is another myth. If I have financial power of attorney, I don't need a healthcare power of attorney. Well, if anybody looks at their financial power of attorney, which is regularly called POA, you do not have healthcare power of attorney. So financial power of attorney only has to do with money. On your financial power of attorney, it might say something about health, but all it says is that the power of attorney can pay for your bills or they can hire and fire providers, but they can't make decisions about their health care. So it's not, I've read a lot of documents, and it's very rare when you have a financial power of attorney that has a healthcare power of attorney in it too. Another myth is if I name someone as my healthcare agent, I will lose control of my care. In advanced directives, when you do your advanced directives, you document what you want and whether or not the healthcare agent can overturn what you want. And we'll go through this as we go through these advanced directives. And a living will stating, I don't want to receive life-prolonging measures means I have a DNR. That's probably the biggest misunderstanding. So let me see if we can go through these. But I'll explain that. So a living will, a healthcare power of attorney are legal documents. So you complete them. You can either have them completed by a lawyer with you, or you can complete them yourselves and get them notarized. This is a legal document. They're legal documents, whereas a DNR is a medical order. So oftentimes people tell me they have their advance directives, they have healthcare power of attorney and living will. Their living will says they don't want to be put on life support, but it doesn't mean they have a DNR. A DNR is a specific form and it's specific in each state. The advance directives are specific in each state. So, but usually we used to worry at the beginning of advance directive, when people started making them, like in the 90s. And I've been practicing since then, so I've seen kind of the whole, I've seen a lot of changes with advance directives. They used to think that, if you have an advance directive from Florida and you move here, then your advance directives won't be honored. But I've never seen an issue where they say, well, these are from Florida, so they're not legal. The North Carolina advance directive needs to be notarized. Many other states' advance directives do not need to be notarized, which is kind of interesting. And maybe that's why there is a concern about another state's advance directive, because it won't have a notary. So it's actually better to do it in the state you live in, but if you don't and you just happen to be in that other state, I think they will usually be honored. And on the advance directives, there's a place for organ donation. We have that also on our driver's license, but there's also another place on the advance directives. So what is the healthcare power of attorney? It's a person that you choose to speak on your behalf when you're not able to tell the doctors what kind of medical care you want. So it's not a person that makes decisions for you. A lot of times when people say, well, who do you want to make decisions for you? I really try to stress they are not making decisions for you. They are speaking on your behalf. You've told them what you wanted. And the advance directive is only as good as what you've communicated with your loved ones. If you haven't told them, then they just have a piece of paper and they really don't know about all the details. The healthcare power of attorney should know you well. They should be able to represent you medically, so they should be able to be there or be available to the medical people when you have something come up. They have to be physically able so they could do that. They need to be able to speak or be able to communicate. Your healthcare power of attorney or your healthcare agent does not need to be related to you, but they need to honor your wishes. They should know you and agree to this role. When you assign somebody to be your healthcare agent, you need to let them know and ask them if it's okay. They need to be at least 18 years old and they cannot be your paid healthcare provider, because then there could be a conflict of interest. So I had a friend who was in her 80s and her son lived in Florida, and we became really good friends. And she asked me if I'd be her healthcare agent. And I said, sure. She told me what she wanted. I knew what she wanted. She told me that her husband died. He got very sick and he went to kidney failure, and they made a choice not to put him on dialysis. And so he went into hospice care and he died. And she always told me that if she could not live in her own home, she wouldn't, she didn't want to be in a nursing home. She really felt strongly about that. So the son came to visit and we had a nice dinner. And then the next day she has a heart attack. So the son's here, I'm here, and she explained to the son about how she wanted me to be a healthcare agent. We had already completed the documents. So it was a little awkward because it wasn't the son, it was me. But there was no issues with it because he knew that I knew what she wanted and he knew what she wanted as well. But I was the one that spoke on her behalf. So if I don't have a healthcare power of attorney with the document, the healthcare power of attorney is the document, the healthcare agent is the person. If I don't have a healthcare agent or if I don't have the document, who speaks on my behalf? So if you have a legal guardian, if you're a child or you've had a legal guardian, they speak on your behalf. If you have an attorney, in fact, under a general POA, that includes health decisions, but I don't normally see that. And then it goes by relationships. So if you have a husband or wife, then they would be the person to speak on your behalf. So that gets a little dicey when we have couples that are not married, but they're partners. So if they're not married, then their spouse or their partner is not the person that speaks on their behalf. It would go to the next person. It would be either the majority of your parents or your adult children. So if you have 3 children, it would be 2 of them have to agree. And then below that would be the majority of your adult siblings. So if you didn't have any children, it would be your siblings. Or then it would be, and if you don't have that, it would be an individual who has a relationship with you, who's acting in good faith to relay your wishes. And if you don't have that, it's, say it's a homeless person that they couldn't find any loved ones or anybody that could speak for them, it would be the doctor in agreement with another doctor. So that's the order in which these decisions make. So a lot of people who are married think, well, I don't really need to have a healthcare agent. My husband, my wife knows what I want. But it's still good to have it because then you can make sure that you're really clear with them exactly what you want. Some people think that it's more important to have a healthcare agent than it is to have the living will. The living will gives specifics, but as long as your healthcare agent knows what you want, they can speak on your behalf. So the living will documents your end of life wishes. So it's called the living will is also known as an advance directive for a natural death. And so if you look at your personal living will that you might have, it might be called that. So it asks three main questions on the living will. And there's three areas where people can choose not to have life prolonging measures. One is if they have a condition that's incurable and will result in death soon, then you could check that box, and then your desire not to relieve life prolonging measures would come into effect. If you are unconscious and your doctors are confident you will not regain consciousness, that's another box you check. And if you have advanced dementia or substantial irreversible loss of mental function, you won't get better. So these are the three situations where a living will come into play. So a living will is not, you have a heart attack, that's not a condition that is irreversible and won't result in your death soon. People have heart attacks, they still have a heart rate, they're still talking, they're still thinking, they get treated for their heart attack. The living will is important is if your heart disease got so bad that doctors didn't think you were going to get any better, then the question is, do you want to be put on life support? Questions about that one? The question about the advanced stroke versus dementia. So the advanced stroke would be probably in this section. Well, it'll be unconscious and your doctors don't think you'll gain consciousness if you had a very massive stroke. And they could see on the scan, on the brain scan, that the blood in your brain was so immense that you would never recover. That would come into this. The advanced dementia is when a person is very sick with dementia. So what we talked about, in the bed, not really able to communicate. So I always tell my patients, we talk about it. And, they say, well, how long will this last? And when will I die from dementia? Dementia is a terminal illness. But your body fails besides the part that affects your brain, your body is also failing. So hopefully, you do see people that die of dementia in nursing homes, but those are people that are very unstaged in the bed. But normally people that have dementia that are in the community and live with their loved ones, if they've thought about this, if they've gone through the process of making their advance directives, their family is usually able to make those decisions before they get so end stage with their dementia. I have a really good article I share with my patients. It's called The Physical Toll of Dementia. So not only is it the dementia that causes the health decline, but it's the physical things that happen with the dementia. People fall. That's a very common way that people die. You fall, you break a hip, you have to have surgery, or you don't have surgery, and you have a decline.
All right. I think Ed has a question. I'm gonna.
Uh-oh.
If he wants to unmute.
Yes.
Can you hear me? All right.
Hello. What? Can you put that slide back on, please?
Yes.
My question is for someone who's unconscious and will likely not regain conscious, or someone who has advanced dementia, doesn't mean they're necessarily dying. So what does an advanced directive do here? Is it say that you want them to stop feeding you? What does that mean?
Well, if you're unconscious, then you're not able to feed yourself.
Right.
And the advanced directive, the other piece of the advanced directive does talk about a feeding tube. So when we go through the advanced directives itself, there's a question about feeding tube. So if you're unconscious and on your advanced directives, you've documented you do or you don't want a feeding tube. If you don't want a feeding tube, then you die because you can't get your nutrition.
So the advanced directive would direct to stop feeding you under those circumstances. Is that essentially what it is? Okay.
Correct.
Okay.
Correct.
Okay.
And people, I know a lot about dementia. People with dementia, they either die from the sign to me that people are approaching end stage dementia is they start losing weight. So they just don't have that desire, and their body also doesn't manage the food that comes in very well. So if I see somebody and 6 months later, they've lost a significant amount of weight, then we talk about, I think they might be approaching end stage, and we talk about hospice care.
Thank you.
So there are many tools for advanced directives. This is a conversation project. That's something online you can get and print it out. And it sort of goes through, it's a pretty big booklet, maybe 20 pages, and it kind of talks about different scenarios, and it helps you kind of get your thoughts clear about that. Most important is that you get your thoughts clear so you can explain to your family what you want. 5 Wishes is a very similar document to that. You have to pay for it. I think it's $1. So you can order it and they'll mail it to you. And then there are the state-specific advanced directive forms. Let me see. Let me see if I have the state-specific advanced directive form. If I can find this for you guys. Sorry, guys. Do you have that other document? Chris, you can put it up.
Oh, hang on. Let me check. Hold on. And then there was something that came in the Q&A. Andy said, I found some hospitals and caregiving organizations required their own EOL care directives, and healthcare POAs had to be completed and on file when he was responsible for his parents back in 2012 through 2018.
Say it again. I couldn't hear you.
Oh, it's in the Q&A. It says, Andy says he found some hospitals and caregiving organizations required their own EOL care directives, and healthcare POAs had to be completed and on file when he was responsible for his parents back in 2012 through 2018.
So we're talking about having advanced directives on file at the hospital. Is that the question?
I think so.
So they should be on file at the hospital. And unfortunately, a lot of people don't bring in their advanced directives and get them scanned into the medical record. So I work at UNC, and that's when we talk about advanced directives. It's most important is the conversation, but also important is making sure we have the documents on file. So you can scan them into your medical record. You can bring them in and get them scanned into your medical record. Unfortunately, not many people do that. I've done research on it at UNC. It's less than 2% of people have their advanced directive scanned into the medical record.
Gotcha. He was saying that they wouldn't take the state one. They required him to fill out their own forms.
No, that there's some confusion there. So were you thinking about a MOST form? Was this in North Carolina?
Oh, I don't know.
Can the person speak that's having the question?
Yeah, let's see here. Yep, North Carolina. Okay.
So let me show you another form. I'll show you a quick form here. Okay, so this form right here is a MOST form. So these are the two medical forms. So this is the do not resuscitate form. This is the form you can have at home if you don't want to be resuscitated. So it's a medical order. So it's not something you'd get completed by a lawyer. This is something you get completed when you go to your provider. Either a nurse practitioner, physician, or PA can sign this. It's signed right here. And all it says in here is, in the event of cardiac and pulmonary arrest, efforts at CPR should not be initiated. So this is a form that people could have at home. For instance, I talk to my patients about advanced directives, and once I review their documents, then I talk about DNR, because I want to make sure they understand what the advanced directives are and what the purpose of them is before we talk about, this is called a DNR. So this document is important if you have a loved one at home and you go in and they don't come down for breakfast and you go in to check on them and they passed away, you call 911, then they come, and if they're still warm, they'll probably do CPR on them, unless you have this form. Because the living will, the healthcare power of attorney, those are advanced directives. They are legal documents. The rescue squad people, EMS, do not follow. They cannot be. They are not expected to review legal documents. All they can do is follow medical orders. This is a medical order. So this is a medical document. This is an order. whereas the advanced directives are legal documents. So that's why a lot of times when I talk to people about their advanced directives and I say, do you have a DNR? And they say, yes, I say, well, is it the yellow form with the red stop sign? This is the only form that's valid in North Carolina, and it has to be the original. So they call it goldenrod. So the form that the person that asked the question, were they talking about this form? Did they complete this form with the medical staff?
Oh, I'm not sure. Andy, did you want to answer that? Waiting to see.
Okay, so this is a form similar to advanced directive, but it is a medical form. This is a form that the person themselves or their healthcare agent, or in that order down here, you could see their patient, the parent, the healthcare agent, the guardian, the attorney, the spouse. It goes through all the people that can complete this form if they don't have a healthcare agent. So this talks about the level of medical interventions they want to have. I don't usually bring up this form and discuss this form with patients unless I feel like they might be in their last year of life. If you practice long enough, you can kind of get a gut of when you think somebody might be in their last year of life. So I usually try to get these forms discussed at that time. So what this form does, it has the CPR in it right here, up here. And this is a medical order. So it's different than the living will, it's a medical order. And for both of these forms, you can present these to your providers or you could choose not to. Like if you decide, well, you decide, well, she really did not want a DNR. We really want to do CPR on her because maybe there's a chance. You do not have to give them this form here. This one talks about, there's several sections in this one. The first section on this MOST form is called MOST form, Medical Order for Scope of Treatment. Every state has this. I had a little chart back here. So these pinks, these are all different states, and on the pink, they're all states that have this MOST program. Sometimes they're called POST, which is a physician's order for life-sustaining treatment. Oregon has been working on their MOST form since the 90s. North Carolina created their MOST form in 2008. So the longer you have your MOST form or in place, the more they can tweak it to be the way they think it to provide the purpose that they want it to provide. So, but if you look at the MOST forms, I've looked at lots of MOST forms or POST forms in different states for friends and family members that, like when I live in Kentucky, do they have a form? I said, yeah, you need to talk to them about this MOST form. They're pretty similar. I do like this part right here because this form, this DNR form has been around for a very long time, probably, I don't know, 1990s somewhere. And it says, do not resuscitate.
May I stop for just a minute, Nancy? For people that are looking at this, if you want to blow up the form, if you look at your screen next to Nancy's picture, you should see 2 vertical lines. If you hover your mouse over the 2 vertical lines, you can make Nancy smaller and make the form bigger so you can actually read it. Thank you, Nancy.
Thanks for clarifying that. So the section B talks about, so what I was saying about why I like this one is because when it says do not resuscitate is really do not attempt to resuscitate. Because just because you try to resuscitate somebody doesn't mean that they're going to come back. It's not like TV. The chances of somebody in the hospital that's resuscitated that is elderly in their 80s or 90s, the chance that they will walk out or be back to their normal self is like less than 1%. And people don't really understand that because they see it on TV, they do the CPR and then they, get well and they survive. So this form says do not attempt resuscitation. So it's sort of a little nuance, but I like that. So the medical interventions. So when you're very sick, you can make a decision about when you're sick, but you're not in the hospital. This is to be done ahead of time or to have your healthcare agent complete it. If for patients with dementia, the healthcare agent completes these with me. So there's several choices. Full scope of treatment, which means you want to go to the hospital, you want everything done, everything, and I'm saying in quotes because everything doesn't always mean it's in your best interest. So everything done means you go to the ICU, you get put on a ventilator, that's full scope. The next one is limited additional treatment, which means you go to the hospital, they might give you fluids, they might give you antibiotics, they might do an EKG just to monitor your heart, but you're not getting aggressive care in the hospital. And the other choice is comfort measures. This means that you do not go to the hospital, that you be kept at home or wherever you live. It says do not transfer to hospital unless comfort needs cannot be met in current location. So this is, not everybody has these forms. I don't know what percentage of people have these forms, but these forms are available and they are approved. These are state approved forms approved by the legislature. They have a little code on them. North Carolina Department of Health and Human Services created them. So that's section A, that's section B, and you can fill out part of this, you can fill out all of it. Section C talks about antibiotics, whether or not you want to have antibiotics when you're at the end of life.
All right, so Ed had another question.
Well, when you say not everybody has this form, if I would like to find these forms, where do I go?
You would go to the North Carolina the medical board.
The North Carolina Medical Board?
Yeah, or you can just Google. You could Google, and I just looked this up yesterday. You can just Google NC Most PDF, and you'll find the form. But they do have them on their website. So just like NC MOST PDF.
How about the do not resuscitate order? The
You
yellow form.
You can see the same. You can find the same one, but they'll be the sample copies. They will not be. So they'll have the sample through them, which means that they're not the forms. Well, so this one has to be signed by a medical provider, but this one has to be signed by a medical provider as well as the person.
So can I get this from my medical provider, from my doctor, these forms?
Yes, you should be able to get them from your doctor. You can bring the sample in, you have a discussion with your doctor, your nurse practitioner, and they should be able to complete the form for you.
But do they have the form to begin with?
They should have the form. And the reason I say they should have the form is,
thank you.
I've been working in neurology for 8 years. When I first started working in neurology, they did not have a do not resuscitate form in the clinic. And I thought, that's ridiculous. People die from neurodegenerative diseases. And so, we had to order the forms, we get the forms, and now we also have the most form. So this most form, it takes a long time to explain and go through. It will probably take 45 minutes to go through all the choices and explain and answer people's questions. So most providers do not want to or cannot spend that time, which is unfortunate. Now, a couple years ago, Medicare approved a code so that providers can review this, or do get reimbursed for reviewing this form with patients. So there is some reason they do have that available. But any medical provider should have them. You guys can, reach out to me privately if you are struggling and trying to figure out how to get this to work. But again, I don't recommend this form unless you're in your last year of life. Because like down here, when it talks about antibiotics, right now, when you're healthy or, semi-healthy, able to manage your own care, enjoy your family, if you get an infection, you probably want antibiotics. Whereas if somebody's at end of life, the question is, do you want to do antibiotics? Because people die, the way people die, there's only a couple ways that people really die. They die from infection that can't be managed, or they die from being dehydrated and malnourished. So when you think about all the different reasons that people die, cancer, stroke, the reason they die are from those two ways. So, people say, well, how will I die from dementia? Well, if you die, like I said, if you die from dementia from dementia, you'll end up, like I said, in the bed and not being able to eat, and you'll maybe cough and not swallow properly. But this is, when you think about the people, even, thinking about people now with coronavirus, they die from the infection usually. But anyway, so there's a section here about antibiotics, and then there's a section down here about IV fluids and feeding tubes. So you can make a choice about those. So that's why I don't really recommend these unless somebody's at their last year of life. And everybody has their own personal opinion on what they want. The feeding tube is in the advanced directive form. So that is another box that you check in the advanced directive form. Or any other questions? No, okay.
Yeah, not thinking. Did you want me to pull up that other form?
Yeah, let's pull up the form so we can just go over it quickly. We don't have much time.
Just stop sharing your screen and then I'll pull mine up.
Okay, unshare?
Yep.
Do I do new share or no?
We'll just stop. I'll just stop your share and then you can reshare.
Okay, just stop.
How about that?
There you go.
All right, and then let me find it. Is this the right one that you wanted to show?
Thank you. Yeah, if you make that big enough. So the advanced directives, it's called a practical form for all adults. You can have your attorney draft documents for your advanced directives, but you can also do them with this form, which I love this form. It's written on like 5th grade level, and it's written in English as opposed to legal. I feel like legal is another language. So we're going to skip through the first couple pages, Krista, and we'll go to the 3rd page. So the first couple pages are instructions, and you'll read through the instructions, but go back.
Yeah, it's just gonna,
Yeah, get down a little bit to the top of this page. Yeah, back. Okay, healthcare power of attorney. So this is how the form is.
Okay.
And this is an editable form. So if you go online, you can find it. You see where it's blue? That means you can type it in and then you can print it out. So this is the healthcare agent. It's very simple. My name is, and you write Krista. My birthday is whatever. And it says, the person I choose as my healthcare agent is, and you type in there, you put in their name. And this could be handwritten as well. And then I usually only have them put in a cell phone number. That's right, this day and age, that's probably the most important thing, is putting a cell phone number in. And if that person is unable or unwilling to serve as my healthcare agent, then you have a backup. So you put somebody else in. Then there's a section for special instructions. Lots of times people put, I want to be cremated in here. And I always kind of wondered why they did that. You know, if their family knows you want to be cremated, then you're cremated. But I told you, my friend recently died, and they wanted him to sign a form saying he'd be cremated. And we didn't know we had to do that. So he had not done that ahead of time. So then they had to find their power of attorney about, it was a little complicated. So I would put that, I want to be set off in a kayak. That's a good idea. So then down here, you can click organ donation, yes or no. You put in your initials. So then on the next page, that's the healthcare power of attorney. So it's a very simple document. What the complicated part is making sure that your healthcare agent knows what you want. So on the living will is the next page. And it talks about those 3 different situations where you choose not to be put on life prolonging measures. A condition that can't be cured, unconscious and won't wake up, or advanced dementia. So you initial those. And then number 2, this is a little tricky. Don't initial that, don't initial that. It says, because this is tricky, and I've had people do this wrong, and so I review them with them, and then they'll say, oh no, I didn't want that. It's very tricky, even though it's written in English in 5th grade level. Even though I do not want my life prolonged by other life prolonging measures in the situations I've initialed in section above, I do want to receive feeding tubes and feeding. Most people do not want a feeding tube. That's a measure of life support. Other things of life support that we haven't even discussed is things like dialysis and pacemakers, and they're not even included in this, but they have to be part of the discussion. So I had a physician, and he and his wife completed this form, and she initialed that, and I called him up and I said, are you sure you wanted that? Not that I want to give them my perspective. I really try very hard not to give my perspective, but I really want to make sure people know what they want. And I've been doing this for such a long time. Most of my patients have completed their documents. And I told you about less than 2% of people have them in their medical records at UNC. And I have over 50% for my patients, because it's like an obsession. Because I really feel like it's really important. And you know, there's so many things we can do when we go to a healthcare provider, but this is really important. So the number 2 would be, I don't want to have a feeding tube. And then you can initial if you do want a feeding tube. 3 is, I wish to be made comfortable. 4 is, my healthcare providers may rely on this living will. And then 5 is important. And this one is a little confusing. And basically what it says is, if I've appointed a healthcare agent in this, and if I've completed a living will, you have 2 choices here. You should initial 1. Follow this living will. It means my healthcare agent cannot make decisions that are different from what I've stated in this living will. So say you said above, you don't want to be put on life support, and you have a healthcare agent. Your healthcare agent said, I just can't let her go. I just want, please put her on the ventilator. Well, if you check, follow this living will, then that healthcare agent cannot change your wishes. On the other hand, you can say, follow my healthcare agent. My healthcare agent has the authority to make decisions that are different than what's indicated on the living will. Sometimes people complete this because I think it has to do with a little bit of a level of distrust of the medical system, that they might be afraid that the doctors might say, well, there's nothing we can do. And the healthcare agent says, well, I still want the person that's completing the form thinks, well, I want to get another opinion or something like that. So that's when people choose which to follow, the living will or the healthcare agent. And I really like that because it shouldn't come into play that these forms aren't valid. And then you complete those first 2 pages, and then you just do part C in front of a notary and get it notarized and witnessed and sign it. Don't sign it before you get in front of the notary. So it's a really pretty simple form. I've read a lot of healthcare power of attorneys and living will documents for patients to review them. But I really like that form, and I am biased because it's easy to understand. And I know I've gone over my time, so I'm sorry, Krista.
No, it's fine. It's fine. So I think Ed's got another question, so I'm going to let him ask. This is such an important topic that I think it's worth taking a little extra time on.
So this last form that you referred to, I can download that if I go to Google.
Yes, and Krista can send you if you have any emails of people. Krista can send them out.
Yeah, I sent those along this morning, not long before we got started. So it's probably in your email, but if you did not get it, let me know and I will send it.
Well, I did. I printed out the forms that you sent this morning, Krista. There is a Part A, healthcare power of attorney, and there's a B, living will, and there's a C, completing the document. But there's nothing. There's nothing from advanced directive, which is what you said at the end of this. There's a.
How many pages is it?
One. Well, the power of attorney is 1 page. The living will is 1 page. And completing document is 1 page. A, B, and C.
Oh, is it missing part of it? I could resend them.
Yeah. It should be 5 pages in all. The first 2 pages are instructions.
The first 2 pages are instructions, yes.
This is the document. This is the form.
An advanced directive.
So advanced directives are the combination of the living will and the healthcare power of attorney.
Got it. Okay.
So maybe that's why you did. So that's what advanced directives are. Both of those documents together.
Thank you.
Thanks. And we do it in advance. That's what I try to people. It's in advance. We do it ahead of time.
Excellent presentation. Thank you so much, Nancy.
You're welcome. And if you have questions, you can send me an email. I think my email might be on the beginning of the first slide.
And Susan is saying that she has hard copies of the documents in her office at the Eastern Center. So if anyone needs those, we do have some at the Eastern Center.
And I want to make one comment on here. Nancy, it was phenomenal. The comment I want to make is the fact that when we fill these forms out for ourselves, we are really we are giving our family member a gift, because there's nothing harder on a family member than being in the situation where they're trying to make a decision for a loved one and they're not exactly sure what the best decision is. So having these conversations with your loved ones, filling out the paperwork, like Nancy said, that's how she's getting from her own children. Yeah. Is getting it as a gift for her birthday. So
and I'm so glad you said that, because there's a poem I read that I found, doing research, and I just want to read this poem to you guys. And it's written by a physician who has done her advanced directives and is letting her family know that she wants them to follow her advanced directives and she trusts them. So this poem is called, and sometimes I cry when I read it, so I just try not to cry when I read it. Don't panic, it's okay. If you are faced with a decision that you're not ready for, it's okay. I'll try to let you know what I would want for various circumstances, but if you come to something we haven't anticipated, it's okay. And if you come to a decision point and what you decide results in my death, it's okay. You don't need to worry that you've caused my death. You haven't. I will die because of my illness or my body failing or whatever. You don't need to feel responsible. Forgiveness is not required. But if you feel bad, responsible, guilty, first of all, don't. And second of all, you are loved and forgiven. If you're faced with a snap decision, don't panic. Choose comfort, choose home, choose less intervention, choose to be together at my side holding my hand, singing, laughing, loving, celebrating, and carrying on. I will keep loving you and watching you and being proud of you. that's the part I start crying at.
That's great.
So, and we can all think, you know, I think I cry about it because I think back about all the times I've like been with loved ones that have died and just thinking about that whole situation.
Sure.
Right. And I worked in a dementia unit, and one of my residents, he was a physician, and he had made the decision, and his family was very clear, and it was such a gift that the physician said, no, I do not want antibiotics. I do not want to be prolonged, because he had dementia. And there was such peace within the family because they knew they were following his decisions.
Right.
So
It is a gift. That's what I want for my birthday. I'm not sticking with it.
Well, hopefully
well, I've got to skip over to Dennis's call. So thank you so much, Nancy. I'm gonna jump off. Thank you so much.
All right. And the only reason I didn't show Jackie just then is because she has this very funny mask on because she's in the office, and I just felt like, given how serious the talk was, it went.
Yeah, that was good.
Sorry. But does anyone else have any questions before we continue? We have, Val has a question. Let me allow her. If you want to unmute, Val.
Nancy, the question I have relates to where on this form would you indicate that you want your body donated for medical research?
There is no place on this form. I just had that question come up recently, and it's I do have information about it. UNC that what you would do. Let me see if I can find it on my little. The reason I'm bringing it up is because donation. Let me see. DON. When I just recently had to send this to somebody, and it was kind of, I don't know, funny for me. It's because the summary on this contact that I had says, a body donation at time of death never goes as smooth as you may wish. Please note and keep this email. This is what the person, because I had contacted the person at UNC. And it's complicated, but it's the UNC, there's a phone number at UNC to donate your body. If you have cancer, if you have infection, then they can't take your body. But yeah, I could, the number, I will read you the number if you want. And from them, you get a form. It's 919
Okay.
966
966
1134.
1134. Thank you.
Yeah. But it's complicated. It says that you'd have to list the funeral home as UNC Medical Science Teaching Lab. Then you call UNC Body Transport. And it says in my note, it says, an older man who sounds ill will probably answer, and you will give him information about the transport. He will then ask to speak to a family member who will assure them they will have a check ready for payment at time of removal, because you have to pay for that. So it's a little complicated, but if you call that number, they'll get a man that maybe sounds like an older man, but
Okay.
it sounds I don't know.
Thank you.
It's not so easy.
Wow.
Yeah, and even brain donations are not so easy. A lot of our patients with dementia wanted to donate their brains, and I found a couple places, a Harvard brain donation in Miami, but research in dementia is not that they're using many brains for donation for research.
Gotcha.
Thanks.
Yeah.
And so, and Mary was asking if you could share if there's a way to get a tip.
Sure, I'll send it to Krista.
Okay.
Yeah, yeah.
Thank you. All right. Did anyone else have any further questions? Well, if anyone else has questions later, feel free to email me and I could pass.
And I'll type my email in here if you guys want. I'll just put it in here.
Okay. Excellent. Thank you. I appreciate it.
Well, thanks for inviting me. Thanks for your attention.
Yes, thank you very much. All right. So that was,
I have the next person.
yes.
Now you have the next talk. What's the next talk, Krista?
The next talk is on bone health. We have, and I believe Pat is on. Yes. So we have Pat Balmediano. I hope I'm pronouncing that correctly. Pat's a graduate student at UNC Chapel Hill, getting a master's in public health and training to be a registered dietitian. And so currently an intern at the Chatham County Public Health Department. And so I'm going to go ahead and introduce you to Pat.
All right.
Hey, good morning, Pat.
Good morning. Good morning, everyone. I hope everyone's doing all right. I'll definitely be switching the topic on y'all. We'll be talking about nutrition and food today. Let me just get my PowerPoint up. How does that look? Is that the PowerPoint?
It's a little small, but I think it's,
Oh,
I'm gonna see it, so it's fine. I don't know if there's a way to make it, yeah, that's better.
okay. Okay. All right, so like I said, I'm Pat Balmediano, a graduate student at UNC, and I'm getting my master's in public health and nutrition. And today I'll be talking to you about nutrition and bone health for older adults. And I just want to say thank you to everyone who is here and wanting to listen to me. So I actually wanted to open up discussion first. Does anyone want to talk a little bit about what their relationship is with bone health? Is it something that you think about a lot, or is it not something that is on the forefront of your mind?
Well, I'll just say something. I don't know if anyone else
Okay.
wants to say, but you know, I'm on the slimmer side, and I have European descent, and so those are a couple of things I know that oftentimes women, as they get older, particularly I guess with European descent, sometimes have a problem with bone density as they get older. So I may be wrong there, but that was my
I
understanding.
actually have not seen, or I haven't researched much about like different lineages and backgrounds and how their bone density is, but that's an interesting idea. I'll definitely have to look that up.
Right, of course, now that I've said that, I'm like, well, maybe I'm wrong, but
I'm not sure.
I heard that might be old news, but it's definitely something I think I personally think about. Yeah, I'm 43, and so I'm probably on the younger end of the attendees today, but it's definitely something I know that I need to be concerned about.
Yeah, even I, like someone who's, you know, on the young side, when I was researching for this topic, I realized that I definitely wasn't getting enough calcium. And as, you know, a female, that's something that I should really be thinking about. Okay, so let's start with why bone health and nutrition is important for older adults. So as you may already know, hip fractures increase notably with age. And with hip fractures, it has a negative effect on your quality of life and your functional status. So you may be able to live longer, but you can't do all your favorite activities. You can't, if you have a garden, it'll be harder for you to do that or go for walks. And while most of hip fractures happen because of falls, if you have osteoporosis or just low bone density, even weight-bearing activities, like simple weight-bearing activities, can cause injuries. And this is because, you know, your bones are more brittle and they're more prone to fracture or breakage. So if you prevent osteoporosis in the first place or reduce the amount of bone loss you're experiencing, which is natural in older adults, your risk of experiencing bone breakage will go down. And nutrition comes in with this topic because malnutrition is associated with higher risks of fractures anywhere in the body. It's also associated with harder time in recovery, more complications, and lower bone density. And malnutrition can sound like an extreme term, and some people may think that it's not a huge issue in the US, but actually 33% of older adults admitted to hospitals in North Carolina experience malnutrition. Malnutrition is when someone doesn't get enough nutrients, and these can be micronutrients, things like vitamins and minerals, or macronutrients like carbohydrates, fat, and protein, or not getting enough calories. And today we'll be focusing more on the micronutrient side, the vitamins and minerals. So overall, nutrition definitely has a role in bone health, whether it's in preventing low bone density or breakages, or in helping in recovery if that happens. So I have another question, but we can skip this if no one wants to share. What do you already know about the role of nutrition in bone health? I'm sure we've known about like the dairy and calcium. So I just wanted to see what people know.
All right, anyone other than me, because I've already put it out there. Does anyone have anything they want to add or say, or we won't even say who said it. If you want to just message me privately in case you're worried you're wrong, you could just send it to Krista in the chat, and then no one will answer it in case you're wrong. They're all shy.
Well, we can move on. That's fine. I just didn't want to be like going on over and over about something that.
That's fine. Yeah.
Okay, so we're just going to go into the background of these three key nutrients: calcium, vitamin D, and vitamin K. And these are vitamins and minerals that are all involved in processes in the body that reduce bone loss and keep bones healthy. And it's been found that most Americans don't get the daily recommendation of these nutrients. So it's really important that we're aware how much we need to eat to get adequate amounts of them. So calcium, it's the thing that everyone talks about with bone health, as you may already know. The RDA, or the recommended dietary allowance for calcium, for men between 51 and 70 years, it's 1,000 milligrams per day. And for women over 51 years, it's 1,200 milligrams. So calcium is the most abundant mineral in the body, and it gives structure to our bones. The bone building process the bone building process in the body, it uses certain cells called osteoblasts, and these cells, they require calcium to do their job. And calcium, it's not just, it doesn't just play a role in bones, it also has a role in muscle contractions, metabolism, wound healing, and nerve impulses. So it's a lot of motor functions that also use calcium. But unfortunately, the absorption of calcium decreases with age. And that's why you see that the RDA increases for adults over 70. And you may already know this, but it's also higher in women who are 51 to 70 years because of menopause and the decrease of estrogen in the body. It means that you're not able to retain as much calcium from food as before. So when calcium levels are low in the body, the calcium in your bones are actually leaked out. So the body has enough calcium for those functions we talked about. So this makes your bones weaker and leads to low bone density and eventually osteoporosis. And while consuming calcium as an older adult can't reverse or completely prevent bone loss, calcium intake will lessen the degree and kind of help your bones be as strong as they can be at that time period. And it just means you'll have higher functional status for longer and be able to do more physical activities for longer. So the next nutrient we'll be talking about is vitamin D, which is very important to bone health. It maintains the balance of calcium in the body. It works with hormones, and it maximizes your absorption of calcium in the intestines. So not only, it just makes sure that you're getting all the calcium you can get from the food you're getting. So you're getting more bang for your buck. It also decreases calcium loss in the kidneys when calcium levels are low. So your body retains more of that. And here we have the RDA for vitamin D. It also increases after you're 50. So you're going from 400 to 800 IU to 800 to 1000 IU for adults over 50. In a study where the dietary intake of older adults were looked at over several years, they found that calcium-rich foods like milk, yogurt, and cheese, they were only protective against bone density loss when vitamin D supplements were also taken. So if you're not getting enough vitamin D, even if you're getting a lot of calcium, you might not be using that as effectively as you can. And technically, vitamin D is a non-essential nutrient, and that's because your body can make vitamin D by itself. And that process is mediated by UV rays hitting your skin. So that's why you hear vitamin D called the sun vitamin. However, it can be hard to get enough direct sunlight, depending on where you live or your skin tone, to get enough vitamin D, and we'll talk about this later. And I decided to include vitamin K because it's part of the mechanism of bone mineralization. So the way your body makes your bones strong and builds them up, vitamin K is really important in that because it makes sure that the proteins in your bone, they're able to bind to the calcium that makes them strong. And there hasn't been a health claim for vitamin K that's been made through the government or the FDA. So there's only adequate intake for vitamin K and not RDA. So for adult males, your adequate intake is 120 micrograms, and for adult females, it's 90 micrograms. And that adequate intake amount is just based on the average amount that Americans get. So now we'll move on to learning how to increase intake of these nutrients. We'll talk about practical tips on how to get more calcium, vitamin D, and vitamin K, and also about supplements if that's something that is necessary for you. Okay, so let's talk about increasing calcium. First, I recommend using this calcium calculator to see the usual amount of calcium that you're already getting in your diet. It'll tell you how much more calcium you need to consume if you're not getting enough. If there's time at the end of the webinar, we can have a volunteer, or I can put in my weekly diet and I'll show you how the calculator works and how easy it is to use. A practical tip on increasing your calcium is to make sure you're looking at nutrition labels. They actually recently changed the nutrition labels, so there's a little bit of subtle differences between the old one. But you can see the calcium amount down here at the bottom. I've circled it in red. And it tells you the raw amount, the milligrams, and it also tells you the daily value. But the percent daily value is actually, it might not apply to you specifically because it's meant to be daily value of all Americans. So that includes people who are younger. So I recommend just looking at the milligrams amount. Another practical tip on increasing your calcium is to use non-fat powdered milk, because 1 tablespoon of it has 50 milligrams. And if you're already drinking milk or eating cereal or eating oatmeal in the mornings, you can add a tablespoon of powdered milk in there and you probably won't even taste the difference. You could also add it in soups or mashed potatoes or pudding. I just recommend making sure you whisk that really well so you don't get clumps of powder in your milk. And another practical tip is that excess sodium can cause the body to lose calcium. If the nutrition label lists that the sodium amount is 20% or more of your daily value, so it would say that right over here. This one's a 7% daily value sodium. If that says 20% or more, that food is too high in sodium and it might make your body lose calcium. And the same goes for excessive protein. So that's eating multiple servings of meat and protein with every single meal every day. That could cause your body to lose calcium as well. However, I want to make sure to say that getting enough protein is also helpful for bone health, because it helps you keep your muscle strength and that leads to less falls. So don't suddenly stop eating protein because you think it'll help with calcium. It's all about the balanced diet. So I made a short list here of foods that have calcium. As you can see, it can range from fruits like oranges that have 55 milligrams to yogurt that has 310 milligrams per serving. At the end of the PowerPoint, I'm pretty sure I sent out, there's a a resources page to this presentation, and you could find, there's a link there where you could put in the foods that you eat, and it'll tell you how much calcium is in there. So if you're interested in that, you could look that up.
And I was just going to say too, I know that I sent out some stuff today with presentation materials. The materials for this presentation on bone health, the link for that is within the conference program. And so you can find that handout linked within the program itself. So if you're wondering why that didn't come through this morning, that you do have the link already if you have the program. Thanks.
Thank you. And on the right, I've added even more tips for you that you could use every day. For veggies that have calcium, the best way to cook them so that it retains as much of the mineral as possible is to steam them. Because when you cook something or cook veggies for too long, it can lose or denature some of the nutrients in the food. And if you cook your foods or vegetables for long, it doesn't mean that it's not going to have any nutrients. It just means that it'll have a little bit less. So if you want to get the most amount, steaming or like boiling them for just a couple of minutes is probably the best way for you to do that. And I mentioned that excess sodium and protein can be detrimental to calcium levels. Another thing that can be detrimental is called oxalic acid. And you don't have to remember the name of that, but just know that it's in some vegetables like spinach, rhubarb, and some beans. And oxalic acid, it just prevents your body from absorbing all of the calcium. So like how vitamin D, make sure that you absorb all of the calcium. This acid does the opposite of that. So if you're getting all of your calcium from just those foods, you might want to consider adding another type of food or taking a supplement. And finally, if you drink non-dairy milks like almond milk or soy milk, just make sure you're shaking the container before pouring because they're fortified with calcium and that can settle on the bottom of the container. So just shake it up real good before you pour in the morning. And I didn't write this in the slide, but a good way to get calcium throughout the day is to, if you like drinking milk, you can drink a cup of dairy or non-dairy milk with breakfast and lunch. That's already, see on the chart, that's already around 600 milligrams of calcium. So that's half of your calcium right there. And milk is really easy to drink. And even though like veggies and fruits don't have that much calcium per serving, for an orange it's 55, it's only 55. If you eat fresh veggies and fruits or canned or frozen, that can definitely add up throughout the day. So I recommend trying as best as you can to get the 5 a day serving of fruits and veggies. And that can really add up your calcium intake. So now we'll talk about calcium supplements because I know that 1200 milligrams can be really hard to reach in a day. And if you don't have that big of an appetite, that's really tough to do, trying to get all your calcium and nutrients from just eating. So in general, calcium is best absorbed when you're eating 500 or 600 milligrams or less at a time. This goes for both food sources and supplements. So don't eat this just means don't eat all of the calcium at breakfast. You may not absorb it as well. So for supplements, you want to pick ones with a dose of less than 500 milligrams. So you can just take the amount you need throughout the day. And you also want to spread, yes. So going off of nutrient absorption, the best forms of calcium supplements for your body to get as much as it can from the supplement is the calcium citrate and calcium malonate. So all you have to do for this is make sure that the label lists either citrate or malonate for the ingredients. And just like with any supplement, you want to make sure you're talking to your healthcare provider because calcium supplements, especially with excess calcium supplements, it can have risks of heart disease or prostate cancer and kidney disease. You want to make sure you're talking to your doctor and mention any other supplements you're planning on taking or already taking, and any drugs you're taking to make sure there's no interactions happening. So here's a kind of a step-by-step list of how to choose a calcium supplement. First, you want to use that calcium calculator I talked about and subtract the number that you got from the calcium calculator from that 1200 milligrams and only take the amount that you need and no more. Like it says in the name, supplements are supplements. You want to make sure that you're getting as much as you can from your food and only use the supplement to get to that 1200. You don't want it to replace your food. And like I said before, excessive supplementation can be harmful for you. Next, you want to choose a brand name supplement, and you want to look for this USP verification. This just indicates that the ingredients in the label are accurate and that there are no harmful contaminants and that the supplement will actually break down in your body and be able to be absorbed. The supplement industry is not regulated in the US, so it's important to find the supplement brands that have done the optional testing and are deemed safe. When you pick your supplement, you want to take notice of the serving size and how much calcium is in each tablet. You might have to take the tablet twice or 3 times a day to meet your needs, just depending on that particular supplement and your needs. You want to make sure that you take your calcium in food, and when you start a new supplement, start with a smaller amount so that you let your body adjust. So that's 200 to 300 milligrams a day, and then you can increase it after a week or so. And again, talk to your healthcare provider about any risks and any possible drug interactions. So now let's move on to vitamin D, which, like I said, is just as important as calcium. The fish listed here, swordfish, bluefish, salmon, and sardines, they have the highest amount of vitamin D. And milk, cereal, and juices, like orange juice, they can be fortified with vitamin D. So just make sure to check the nutrition label and see if they contain any of this vitamin. The amount of vitamin D is listed is right above the amount of calcium. So they're right there next to each other, which makes it helpful. And you could also, if you want to get some free vitamin D, you could also go out into the sun every day, and maybe if you like taking a walk in the morning, that could be a good way for you to get some free vitamin D, or if you could sit on your uncovered porch. But like I said, it depends on your skin tone, the time of the year, and what time of day it is. So it's just really hard to measure how much vitamin D you're getting from being outside. And if you're wearing any SPF, or if you're wearing any sort of coverings, that doesn't start the vitamin D production in your skin. So if you're at a risk for skin cancer, or so if you're having to wear SPF every day, that means you're not getting the vitamin D from the sun. So many people find that the easiest way to get the RDA for vitamin D is to take supplements, because fish can be quite expensive for people to buy, especially fresh fish. And if you're having to eat that every day, that can really add up, like money-wise. And it's actually been found that a lot of Americans are deficient in vitamin D, even if they're already getting enough calcium from milk. So that just shows that we're not fortifying our milk with enough vitamin D. So relying on the vitamin D in fortified milk might not be getting you to that threshold that you need. And if you are planning on taking a vitamin D supplement, I would just use the same steps that I talked about before with choosing a calcium supplement, making sure that it's been tested and looking at the serving size and all of what I said before. So I just put the fish here and the amount of vitamin D that they have. Eggs actually have 1 micrograms of vitamin D, which is interesting. I did not know that. So if you like fish, this is definitely a good news for you. But if you like canned sardines or packed tuna, that also has vitamin D. That's probably a cheaper way of getting this getting fish and getting the vitamin D that comes with that. And now we're at vitamin K. If you like eating greens and eat them regularly, you're probably eating enough vitamin K. Again, if you are thinking about taking a supplement, you should ask your healthcare provider, because vitamin K supplements can have negative interactions with blood thinning drugs. So if you're taking any of those medications, consult your healthcare professional first before taking any supplements. So here are just some of the foods that have vitamin K. There's collard greens, kale, spinach, Brussels sprouts, romaine lettuce. So basically anything green, it's probably going to have a little bit of vitamin K in there for you. Here I have some tips for increasing your vitamin K. If you don't like eating raw greens, because they can be quite tough to eat, you could try steaming, boiling, or sauteing them quickly to make them more tender. I personally don't like eating raw kale or collard greens. It's really hard for me to chew, and just everything's tough. So I like adding them to soup so that they soften a little bit and they're easier to eat. I actually like baking them into casseroles, so they're kind of just buried in there. You could also make a big batch of boiled or steamed greens so that you can eat them throughout the week. This can save you time, and it also saves you space in the fridge. When I don't know how y'all buy kale or collard greens, but at the supermarket, they come in these huge stalks. So they always take up so much room in my fridge. So I like just going ahead and cooking them all in one go and putting them in a small, tiny container. It's amazing how much space you can save when you cook greens. And if you like smoothies, you can try making a green smoothie. You can do that by adding spinach. And this is a really easy way of getting your greens in. And you probably won't even taste the spinach on top of the fruit, especially if you add peanut butter or almond butter or milk. But in my experience, it doesn't actually look green. It looks more brown. So don't let that deter you, because it can still be yummy. Just add in a lot of fruits. Okay, so that is the end of my presentation. I just wanted to do a quick recap of what I talked about today. So nutrition is very involved in bone health, both in prevention of breaks and fractures and also in recovery. You want to make sure that you're getting enough of those micronutrients like what I talked about today, and also macronutrients, like getting enough calories, because being underweight is linked with higher risk of fractures. Vitamin D is just as important as calcium for bone health, especially for older adults, because your calcium needs are higher, and you want to make sure you're getting the most calcium as you can from the food you're eating. Vitamin K, it's involved in the process that makes bones strong, and the foods that are highest in vitamin K are foods that will probably help with your overall health. Everyone knows that greens are good for you. So if you're eating those types of foods, you are not only helping your bone health, but you're probably helping your overall health as well. And eating a balanced diet with as much fruits and vegetables as you can will help you get most of these nutrients, and will help you get most of the way, if not all of the way, to that recommended daily allowance. But if you have trouble getting all of those nutrients just from your diet, don't be afraid to try supplements, as long as you don't use them to replace food. You want to make sure that you're choosing them wisely, and if you can't get all of your nutrients from the diet. If anyone wants to share, I'd love to know what y'all learned, if there was anything new, or if this was all just kind of a rehash of what you've learned from your past experiences or your healthcare professional.
Anyone have any remarks? I know that I found out a few years ago that I was vitamin D deficient through blood work. So I wouldn't have realized had I not gone, for my physical and had the blood work. So that's a thing to keep up with. Make sure you go in and get your annual exams with your primary care professional. Andy says it reminded him of the importance of reading those nutrition labels.
We're actually doing a nutrition label webinar. So that will be shown, I think, in August.
That'll be great.
Mm-hmm.
What else? Does anyone else have any questions? Did you want to show us how to use that calcium calculator?
Sure. Okay. Can you still see my screen?
Yep.
Okay. So this is our calcium calculator. And they're going to ask you a little bit of your information so that they could put in they could use the right RDA for you. So I'm just going to put 70 years because that's the 1200 milligram RDA. And I'm going to put no. So it just has a big list of foods that you can choose through. It also has like calcium supplements if you're already taking that. So if I'm drinking 1 cup of milk every single day for the whole week, I would put in 7 because it says number of weekly servings. If you're drinking 2 cups of milk every day, you'll have to put 14. And there's also soy milk that is enriched with calcium. If you're drinking almond milk or some sort of other milk, make sure to check the amount of calcium that's in there because these look like they're not fortified. But if you see that your non-dairy milk has like 240 milligrams or 300 milligrams already, you could it's probably fine for you to put in soy drink, because, even though you're drinking almond milk, if that makes sense. So. And this is also just approximations because every brand is going to be different. And this is just one source of information. So just know that some milk could have like 250 as opposed to 240 or maybe 300. So check those labels. And this is yogurt. Just remember that this is weekly servings. The first time that I did this, I only put in my daily servings. And when I came out with a number, I was like, am I really that deficient in calcium? Then I had to redo the whole thing because I did not look at the instructions. And there's cheese, which does have quite a lot of calcium as well. We have desserts, which everyone loves. Eggs, so I probably eat an egg a day or 2 eggs a day. Let's put 14 there.
That's interesting because it kind of shows you a little bit more of that there are more foods than you might think that have some calcium in them.
Yes, definitely. And it can definitely build up if you're eating enough of that every day. Beans and lentils. And this is also a good way for you to just look at what you're eating now that you're having to think through what you've eaten in the last week. Just kind of give you a clue as to what you might want to eat more of or less of. Even pasta has a little bit of calcium. So that is nice. One thing I don't love about this tool is the serving size in grams. And I don't think I think about food in grams. I think more about it in cups. So if you want to go to Google and maybe do 180 grams of pasta in cups, if that makes it easier for you to put it in here, that's totally fine. I actually have no clue what 180 grams of pasta is.
I'll have to look that up.
Yes. And here are fruits. Looks like figs have quite a lot of calcium in them. And currants, I'm not sure what a currant is actually, but that has around 72 milligrams.
This is saying If it was water, it'd be 3/4 cup.
Mm.
But hold on, 180, well, no. But 180 grams of brown sugar is a cup. I guess it just depends on you because there's weight. 180 grams of rice. Go ahead, sorry, I'll stop.
And vegetables here, broccoli has quite a lot of calcium, and that's a common vegetable that everyone has that most people can have access to, and you can find that at any supermarket. So that's a good source of calcium you can eat every day.
All right, so it looks like it's about a cup of uncooked rice is 180 grams.
Oh, okay. 1 cup of uncooked rice. I'm not sure what that means for boiled.
So a cup cooked is actually weighs a little bit more than that. So, so less than a cup cooked, slightly.
Let's see. Oh, and tofu has calcium as well. That's pretty cool. Okay, so I definitely didn't put in all of what I eat, but we can just go ahead and calculate just to see what you end up with. So it gives you your estimated daily calcium intake, and then it measures that against the 1,200 milligrams that you need, and then it explains to you what it means. It gives you some bone-friendly recipes. Oh, you can go to gives you a table of calcium-rich foods and some recommendations, and then gives you a quick summary of all the foods you ate to tell you which ones have the most and which ones has the least. Oh, that's strange, it's cut off. And it's important to remember it is only an estimate because you don't know exactly how much your body is using or how much your body is able to absorb from that. But this is, I feel like, a pretty good approximation, and it'll help you with choosing a supplement and kind of getting you in tune to what you're already eating. All right, go back to my slides. So if anyone has any questions, please email me. I'd love to research them for you or let you know if I can help you out in any way. But
all right. Does anyone have any questions, comments, anything that surprised you about the different foods that had some calcium in them? Perhaps your favorite way to get calcium? They're so quiet.
that's all right. So I just want to say thank you to everyone who listened to me today. I really appreciate having the time to,
Why just stop?
Yeah. Yes, I just want to, thank you for listening, and I hope that this information was at least a little bit helpful or was a good reminder of how nutrition can play a role in your bone health.
Definitely.
And have a great weekend, everyone.
All right. Thank you so much.
Thank you.
All right. So we typically would do a little brain break with Jackie, but she's helping with something I usually do on a Friday, which is moderating Dennis's conference call. And so while she's doing that, she is not available. So we might go ahead and, well, I guess, you know, you could take a break. You could move around, stand up, you know, whatever, wiggle around in your chair. And then we'll get started with our next guest, who I think is already here, who popped up and then disappeared again. If he's ready, I don't know. So I saw him for a second and then now I don't see him.
This is Dave. I'm here.
Oh, you are on? Okay, good. All right, so I'm gonna go ahead and introduce our next guest. And then probably Jackie will come back on and do her brain break at the end. So our next guest is a former enforcement attorney with the North Carolina Department of Justice's Consumer Protection Division. During his 3 decades there, he battled a growing and increasingly sophisticated network of US-based and overseas fraud groups that target seniors with an assortment of scams. His new book, Elder Fraud Wars, examines the multi-billion-dollar elder fraud industry, the special vulnerabilities of those it targets, and the ease and frequency with which it obtains hundreds of thousands of dollars per victim, and it also has strategies for combating that industry. So we welcome David Kirkman, and I need to find you. Oh, there you are.
Hi.
Hey, good morning. It's still morning.
Good to see you.
Good to see you again.
I've been listening to the last presentation, and I found vitamin K intake and vitamin D intake very important as I became the old man that you see right now. I actually had a vitamin D deficiency and I had vitamin K issues because I'm on blood thinners. And so listening to her, I learned so much, and I really appreciate it.
You know, it's really helpful. I'm glad she could come on. So I'll just leave you to it whenever you're ready.
Okay. Well, thank you for having me on your program. And I really enjoy speaking about elder fraud and about cases I got to handle long ago. That's what lawyers like to do as they get old. They just sit around on the porch and talk about old cases. And my book is about old cases and some recent cases about our battles with the elder fraud industry. And I really hope everybody can check the book out, read it. You'll learn an awful lot about what's really out there and how sophisticated the elder fraud industry has become in the last couple of decades. And like I said, it uses these actual cases. You'll get to know some of the people who were behind the cases as prosecutors and investigators. Some of the victims you'll come to know very well. And in many instances, we actually profile the evildoers, the bad guys, the home repair scammers, or the driveway paving contractors who rip people off for huge amounts of money. I think the best way to get into today's topic and to discuss the book is to read a passage. And these are the first 2 paragraphs of the book. It's in the introduction. The chapter is called "The Elder Fraud Industry Marches Through Town." Each spring when I was, hold on, let me get the slideshow up first. Can you see it?
Not yet. In the bottom, did you see a share screen button at the bottom?
Okay. I am seeing.
If you mouse over it. It might be in green.
Just before I came on, the whole screen changed. I had the share button and everything down there.
Oh, okay. You might be able to, are you able to see me?
I'm able to see you.
Because if you mouse over at the bottom, if you're on the screen where you can see me and you, then you should have a little button at the bottom that says share screen.
No, I'm not seeing that.
Let's see. Best way to help you with that. Let's see.
Here it comes.
Are you seeing it now? Okay.
Okay, share screen.
Yep.
Let's go.
Aha, there we are.
All right.
Perfect.
Right, well, that's the cover of my book. And to start with the first topic, with the first reading, actually, it's from an event that took place in Chapel Hill back when I was in high school. And the passage starts as follows. Each spring when I was in high school, my town hosted a 20-mile charity walkathon. Those of us who participated found ourselves walking through almost every neighborhood in the community. To divert my attention from the aching and throbbing that developed in my legs and feet, I began counting each home or street along the way where there resided a young high school beauty for whom I held an unrequited crush. One year, my final tally was something like 4 dozen. Now, almost 5 decades later, I can take you on a drive along that same walkathon route and point out the homes or streets of older townspeople who have lost $10,000 to $100,000 to con artists. Their number easily exceeds the 4 dozen high school crushes mentioned above. Several homes, in fact, belong to parents or late parents of old schoolmates. I can expand the route out to 3 large retirement communities now situated on the edge of town and show you the cottages and apartments of victims who lost $10,000 or $100,000 or $250,000 apiece. Until recently, I could have done this and taken you on a similar fraud tour in any community in North Carolina. For 3 decades prior to my retirement in 2017, I was an enforcement attorney in the Consumer Protection Division of the North Carolina Attorney General's Office. During the latter portion of my tenure there, I also managed a small unit known as the Elder Fraud Prevent Revictimization Project. It was funded by the Federal Victims of Crime Act and the North Carolina Governor's Crime Commission. As its name and funding sources imply, the project's task was to serve older North Carolina fraud victims and keep them from being victimized again. So what is the elder fraud industry? It's not actually some of these stories of financial exploitation that you hear about where an opportunistic grandson or niece starts preying on Uncle Joe or Aunt Sally, insinuating themselves into their hearts or their financial situation and taking all of their life savings. This is a very common type of elder fraud, financial exploitation. But the type of elder scams and frauds that we dealt with in the Attorney General's office pertain to actual businesses, people who went to work every day intent upon ripping off old people in one way or another. So you can see in this next slide, some of the more prominent members of the international multi-billion-dollar elder fraud industry. It includes home repair scammers, the IRS treasury agent scammers who call you or robocall you day and night telling you you owe money to the federal government or to the state government, driveway paving scammers, foreign lotteries and foreign sweepstakes, the grandparent scammers, and the Nigerian money transfer schemes, which have actually been around for a long time. They used to send you letters in the mail saying they wanted to move $24 million from Nigeria or some other country into the United States, and they needed your bank account, and they would give you 1/3 of that $24 million if you just helped them out. Now they conduct these scams via the internet. You probably get lots of these bogus emails from somebody saying they want to get money out of the Philippines or Iraq or someplace like that, or that you've had an elderly distant relative die in that country and they have a huge estate and they want to help you get that money back to the United States, your inheritance from that deceased person. So these are the different types of scams that are out there. They're discussed in great length in my book, how they try to set you up and then rip you off repeatedly. The amounts of money that each type of scam group has been able to obtain from North Carolina citizens is pretty staggering. The foreign sweepstakes, the people who tell you you've won the Spanish national sweepstakes or the Canadian sweepstakes, they regularly get people for $10,000 to $100,000 here in North Carolina. And the biggest victim we had for the foreign sweepstakes was a guy who was from the West Coast, but he retired to Asheville and lives in one of the big retirement communities up there. He lost $900,000. The IRS scam, we've had people lose as much as $60,000. Sweetheart scams, which are usually done over the internet when the victim is a woman, or face-to-face when the victim is a man. Our largest loss for an individual victim was $1.2 million. A woman in Greensboro lost $80,000 to a driveway paving scammer from Sanford a few years back. He also ripped off a lady who lived just off Jack Bennett Road here in Chatham County for $9,000 that same day. Money transfer scams from Nigeria, a $3.2 million victim. Foreign lotteries, there was a retired military officer living in Jacksonville who lost $600,000. So the losses can be staggering. So why does this fraud industry target older adults? And the answer is pretty simple. You see the quote here from the famous bank robber Willie Sutton. He said, the reason I rob banks is because that's where the money is. And the reason the elder fraud industry preys upon older citizens, usually people 75 and above, is because that is one of the wealthiest generations ever. There's been recent studies and articles talking about how the so-called silent generation, which is the Korean War generation and World War II generation, plus my generation, the baby boom generation, are by far the wealthiest. We have on average something like $172,000 in net worth. For the next generation down, the Generation X, we are supposedly as a group, as individuals, 8 times wealthier than members of that generation. And we are 22 times wealthier than the millennial generation. And that's obvious because the younger generations are still paying off college loans and they have mortgages and things like that. People in my generation and older, they've paid off, a lot of them have paid off their college loans, their mortgages, even their car payments, even their children and grandchildren's college tuition sometimes. So they have money, they have retirement nest eggs there, they have Social Security. So that's who the industry is set up to go after, because that's the group that has the money. Here are some hallmarks that make elder fraud different from the other 200 types of frauds and scams we handled in the Attorney General's office. It usually involves repeat victimization. We often encounter people, like I mentioned earlier, who've lost large amounts of money. We call them super victims. They're in a specific age group, usually 75 or older. With sweetheart scams, it's more like 60 and older. The elder fraud industry's victims seldom report their victimization. Even the families don't report it all the time. It's something like a 2% reporting rate. And these cases are seldom prosecuted. They are quite difficult for prosecutors to take on for reasons we'll discuss in a minute. But the main thing that differentiates it from the other types of frauds that are out there is the elder fraud industry is engaged in the deliberate exploitation of age-related vulnerabilities. And there are basically a dozen vulnerabilities that the scammers tell us they'd like to exploit. There's some others, but these are the main ones. Some of these are pretty intuitive. You can guess that loneliness and isolation is a biggie. The fact that a lot of people in this income group, even though they're supposedly the wealthiest generation, are still on a fixed income, and they're worried about whether inflation is going to eat that away, whether their nest egg is not going to carry them all the way to the end. There's the additional factor that a lot of us, as I mentioned, we've got 100% equity in our homes, or our debts are paid down. So we have a lot of credit or easy access to credit. Depression, that's something I didn't realize through 2/3 of my career at the Attorney General's office. But for older adults, depression increases. And some of it is biological. It just comes with age. A lot of it, however, is situational. It's because as people get older, they lose their spouses, their siblings, some of their children, lots of their friends. It's a time of life when you have a lot of sad events going on. So situational depression will kick in as well. A lot of people in this age group have impaired vision or hearing or mobility. And the scammers, especially home repair scammers, like to take advantage of that to tell people there's something wrong with their house way up on the roof that they can't see, or down below the house where they can't gain access. There's a strong desire among people in this age group, and even in my age group, to be a decision maker again. When you retire, after a while, you kind of miss being the go-to person, or being busy, or being the decider, if that's what you were. And a lot of these major victims that we just flashed on the screen a while ago were people in very high places, or had very important jobs that required tough decisions. People came to them to make these decisions, and they want to get back in that situation again. And the scammers, as you will read in my book, and as we'll discuss in a minute, would be very adept at placing these people back in the captain's chair, as they called it. We put them in a captain's chair, let him or her make all these decisions and send us all this money. and they feel good about it. They feel good about themselves. People in this age group have a more difficulty, according to geriatricians, controlling obsessions. And some obsessions the scammers really key in on, like if you're a sweepstake scammer, you can go out and buy a list of people who really like sweepstakes or lotteries. These are people who tend to be rather obsessed with it, and just plug away at that obsession, work it, and get this person to send you all kinds of money believing that they've won something and they have to pay taxes on it. One of the I didn't realize how easy it was for scammers to reach me until I retired. When I was working all day long, they couldn't call me, they couldn't knock on the door. And I wasn't paying any attention to these emails from strange sources. But when you're at home all day, they've got access to you. And so people in this age group tend to be more accessible for that reason. But the main age-related vulnerability that the scammers key on, and they look for it really hard, the main ones are age-related cognitive decline. And here are some of the most commonly exploited cognitive impairments they look for. Memory loss, which is mainly they're looking for short-term memory loss. Sometimes you might not remember certain things that happened during a conversation 3 or 4 minutes ago. And scammers know how to exploit that. They also have a trick where the home repair scammer might come to your front door and say, Krista, you still haven't paid me for the $3,000 bill that I gave you a month ago, and I need that money now. And the scammer will be stomping on the front porch, getting really angry. And you might think, well, I'm getting up in age and I'm having these memory issues. I probably forgot to send him a check. I'll write him a check right now. So the guy hasn't done any work at all when he gets a $3,000 check from me. There's a slower, as people age, they process information slower. That's just normal cognitive aging. It's something that all of us are going to suffer. I'm already told that I'm suffering from it. My wife says so. And so the scammers usually sort of throw everything at you so fast that you can't process it. So at the very end, you're going to just start doing whatever he or she suggests because you just haven't been able to follow it. But they say, well, now you need to go pay this much money to this person in Kenya or in Great Britain to get your sweepstakes prize. There's also an impaired judgment in excited or upsetting situations that's more severe as you age. And that's something else that the scammers will exploit. Almost every time they open up this fraudulent pitch, it starts with something very exciting like you've won $20 million, or something very scary like your chimney is about to fall down. And they take that and run with it and run the scams on you. And then, as we said a minute ago, the obsessive and compulsive behaviors. This phenomenon where people want to feel like there's somebody again, the scammers really spend a lot of time on that, making the victims feel important. So here's how a lot of people view themselves, at least men. That's Gene Kranz getting Apollo 13 back from the moon after the big disaster in outer space. And just so I won't be accused of being sexist, this is Poppy Northcott. She is or was a senior flight engineer for the Apollo 11 project, and she got Neil Armstrong and company to the moon and back. But a lot of, again, these victims, this might have been what they were doing in their earlier life. They were big decision makers, important people. The super victim, that's a phrase that we came up in the Attorney General's office for somebody who had lost $10,000 or more. And we would encounter somebody like this probably every 3 or 4 days. Sometimes we would notice that more times the person was victimized, especially as they got beyond $10,000 in losses. It was harder and harder to stop the scams. It was harder to break them out of the cycle of fraud. Every year we would have about 10 to 12 victims who had lost $100,000 up to $500,000. And these were people who didn't lose it all at once. None of these super victims or mega victims lost it all at once. They would usually lose the money in increments of $2,000, $3,000. The scammers would just keep coming back to them over and over. Scammers call this technique reloading. And it's usually a variation on the same scheme. If you're a sweepstakes scammer or a lottery scammer, you're going to tell somebody they've come in second place in the lottery or in the sweepstakes up in Canada, and you need to wire $5,000 to this address in Canada right now. And as soon as you do that, they're going to call you back and they'll say, oh, Mr. Kirkman, congratulations, you're now the first place winner in our sweepstakes. The original first place winner didn't get their taxes to us in time, and so he was disqualified, and now you're the first place winner. We need you to go back to Harris Teeter or to Lowe's grocery store and wire another $8,000 so you can collect the first prize, which is even bigger. You'll get you'll get $8 million instead of $4 million. So that's called a reload, and it will go on and on until the victim is totally out of money. And some of these reloads will include somebody pretending to be a customs agent at the US-Canadian border saying, Mr. Kirkman, you need to pay $20,000 for customs duties on this $4 million sweepstakes prize I have here in my desk. Or it could be somebody from Lloyd's of London, or somebody pretending to be from that company, telling you you need to pay an insurance premium to protect the delivery of the check to your house. Otherwise, it'll be sent back. And so please, Mr. Kirkman, go wire $15,000 to this address in London. They call it reloading, and they just keep coming back at you over and over again. The targeting techniques for a lot of these scammers, it varies depending on which type of scam they're using. The driveway paving scammers that we'll talk about in a minute, they just drive up and down the road, look for a gravel driveway and a house that looks like it has an older person living there. Same for home repair scammers. For sweetheart scammers, they like to go into social media and dating websites and obituaries, and they will research you very carefully, very heavily, learn all about you, and then they'll start their pitch. They'll become your friend on Facebook or on one of these dating websites, and that will lead fairly quickly into a romance, which then leads into some sort of marriage proposal. And eventually, once this romance is all of Twitter and going strong, then the scams start. This person who claims to be a construction chief working in Saudi Arabia is suddenly in jail and needs bail money to get out. Can you please wire $50,000? And they'll reload over and over and over again these sweetheart scam victims to the point that they're sending hundreds of thousands of dollars to this person that they love who's totally imaginary. The financial and estate planning scammers, they actually buy lead lists of people who fit certain profiles. Are they a certain age? Do they have a certain amount of money? What's their credit rating? And if they see somebody who looks like they have a lot of funds, a lot of credit, they will go after that person. The Nigerian money transfer scammers, you've seen the emails. What they'll do is they'll send out 1 million emails in 1 hour all around the world. And maybe 2 or 3 people will respond to that positively and want to send money to them in order to get the millions of dollars transferred into their bank account here in North Carolina. The foreign lotteries, they do the commercially available lead lists of people of a certain age, but they also use the robocalls. As you know, you get these robocalls day in and day out saying you've won something, press 1 to talk to an operator to collect your prize. Those are done the same way as the money transfer scammers from Nigeria. They go out by the millions, these robocalls. They have one person out of 100,000 may respond positively, but that's enough for these scammers to make big bucks. You can't really reload people over and over again unless you've got a really strong narrative. And so for the sweepstakes we talked about a minute ago, the narrative is always this big pot of money coming to your house in North Carolina. But there's just one more hang up, and we need you to send a few $1,000s more and a few $1,000s more before it finally arrives on your front doorstep. It's called rinse and repeat. And that's what the scammers will do over and over as long as they can. For the home repair scammers, they usually start out by pointing to a so-called problem on your roof that really doesn't exist. They'll say there's chimney flashing on your chimney that's come loose. I can repair that for a few dollars. And then they'll come down off the roof and say, oh, you've got terrible water intrusion into your attic and into your roof, and we need to rebuild your whole roof for you. And that'll be $9,000. And then they'll come back after you've paid that and with the reload and say, oh, you've got water damage in your attic structure. we need to do repairs to your attic. And once you pay $6,000 to $8,000 for that, they come back and they say, now we've just noticed you have all kinds of toxic mold in your walls of your house. You need to move out of your house tonight and stay in a hotel until we can get rid of that. So that'll be another $5,000. And it just goes on and on throughout the house, making up things that aren't really wrong with the house and then pretending to fix them. And that's how a lot of these home repair fraud victims end up losing $100,000 to $150,000. So we've talked about some of these things, and the grandparent scam is one we haven't yet, but it starts out the same way. And a grandchild is in some terrible straits. They've been arrested down in Florida on spring break or in Mexico. They've been in a car wreck. They need money for bail. As soon as you send the money for bail, you need money to pay the rental car company for the car, send another $6,000. And then once that money is sent, they reload and say, oh, the people in the other car or in the hospital, you have to pay your grandson's, you have to pay their medical bills so your grandson doesn't have to go back to jail. So please send another $9,000. And so that's how the typical narrative runs for a grandparent scam. And that's how grandparent scam victims can lose $60,000 in a matter of hours, actually. Here's some more of the narratives that they use. But again, it's just one simple theme, and they just go back to it over and over again. You need to do one more thing, Mr. Kirkman, one more small amount, and it'll all be taken care of. The scammers use lots of tricks to sell their narratives. And, one of the things that they do is they impersonate police or banking officials. The IRS scam is the biggest example of that. A lot of the really good scammers, and this includes the Russian mobsters and the North American motorcycle gangs who do a lot of these grandparent scams, they will make things look very, very, or sound very, very convincing because they've already done their research on you. And they will send these very real looking documents that look like it's your grandson's bail bond application down in Mexico. It just really convinces you that this is really true. And so that's something that everybody needs to look out for whenever you get some of these approaches from these scammers. They will often start out their scam for, say, a sweepstakes or a lottery prize by sending you a check. And it's checks for $10,000 and it's written on the account of a real company. And when you take it to the bank will say, yeah, that's that company's checking account number. And if you cash that check and then follow the instructions to use the money to wire money back to the sweepstakes company in Canada to pay your Canadian taxes, that check will come back about 2 weeks later, totally counterfeit. And in the meantime, you've wired cash up to those people. But the check is one of these things that sells the narratives. Another thing that the Nigerian scammers in particular like to do is after you've paid them or wired them, thousands and thousands of dollars, they will actually wire you some money back. They'll say, Mr. Kirkman, we just wired $2,000 into your account last night just to make sure it was the right account. And then tomorrow we're going to send $24 million into your account. And so they'll do this to keep you on the hook, to keep selling the narratives, even when you start getting suspicious. There was even an instant where the scammers impersonated me to convince a woman up in the western part of the state to wire $30,000 to a location in Canada so she could collect her $1 million prize in the Canadian lottery. The woman had been told by the bank to call our office, the Attorney General's office, to check out this company. And the woman got through to me, and I checked the company out on the computer and said, man, this is total fraud. You send that $30,000, you're never going to see it again. She said, thank you very much. I'm not going to send the money. And the scammers called her, and she said, I talked to Mr. Kirkman at the Attorney General's office, and he said, you're a total scam. And he looked it up on the computer, and they said, okay, thank you. And next thing you know, somebody else calls her, pretending to be me. And the scammers during those few minutes had actually surveilled me. They'd actually called me up and got my voice on the phone and started learning how I spoke. And then they called her back pretending to be me and said, man, this is Dave Kirkman again. I'm sorry I made a mistake. This is a legitimate company. There's just others that use its name to run scams. Why don't you go ahead and go to the bank, and I apologize for the trouble. So she goes to the bank. She's all ready to send the money. But as you read in the book, she was foiled from sending it just in the nick of time and by the grace of God. Threats are another tool that the scammers use to seal the deal. Like I said, they try to make things alarming or exciting to tax your ability to process information or to get you to make a bad decision. And you know, in a situation where you just have adrenaline running all through your body. So the angry man at the door scenario that I did with Kristen a minute ago, that's one of the old favorites. The IRS scam, it always starts out with a notice that you're about to be arrested. That's a threat. The overseas jailer who says he's got your grandchild in jail says he's going to be beaten up or is being beaten up until you send the money. That's a definite threat, and that gets people totally upset, and they forget about all the warnings that are out there about not sending money to people you don't know, and to check out to make sure your grandchild really is on spring break in Mexico before you send the money. There are some that actually threaten death upon their victims when the victim starts a balk, when they start pulling back and saying, you got all my money, I know you're a scam, I figured it out. And these people, they're not going to stop. They're just going to shift gears and start issuing threats against the person's children, against the person's dog, and against the victim themselves. And we had a woman in Carborough who she had lost something like $40,000, and the scammer was pretending that he was coming down Highway 54. He's going to deliver the check for millions of dollars in just a minute, but there was just one more payment that they needed to be made, and she wouldn't do it. And so he started threatening to kill her. She said, "Oh, I'm going to go to the Carborough Police Department." And he said, "That's okay, I've got my killers with me. We'll go to the Carborough Police Department and shoot you up, and we'll shoot up all the police and kill all of them too." Very scary stuff. Fortunately for this woman, she had an FBI agent sitting right next to her as the call came in, and the agent was recording it. The favorite way that these overseas scammers collect money from people is through these two wire service companies that you see. There's a sign usually at the front of every grocery store or pharmacy for one of these two companies. And so this is how, in the past 25 years, most of these overseas scammers have collected money from their victims. And we spend a lot of time in the State Attorney General's office, AGs all across the country, negotiating with these two companies to increase their procedures and their computer systems so they can spot these weird transactions involving older people going to, their money would be going to Spain or to the Philippines or to India, to the IRS scammers, and to clamp down on those types of transfers and stop them. And eventually, they actually did that through some big settlement agreements that came down a couple of years ago. But that's still a popular way for scammers to collect money. Probably about half of the money going overseas to elder fraud scammers is through these two companies. If you hear of somebody in your community, in your church, who's being scammed in this way, call the State Attorney General's office immediately, ask to speak to one of the elder fraud specialists, and they can get Western Union or MoneyGram, or both of them, to interdict all transfers by these victims anywhere. That would just cut them off completely. And that has been one of the most effective ways to stop a lot of these scams. Because of these efforts to stop the use of Western Union and MoneyGram, the scammers are now telling people to go to the bank to wire money bank to bank. And that's a very risky thing for them to do, because whoever picks up the money at the other end can actually be caught for committing wire fraud, which is a big federal felony. Something else the scammers like to do these days is to tell you to go to a big national bank. It's usually not one that you bank at. Take $10,000 in cash, take out a deposit slip, fill out this person's name and this account number, take it to the teller and say, I want to deposit this $10,000 in this man's account. And sure enough, the money will be deposited into that person's account. Whoever that person is, he may be in California or New York, he or she is going to wire the money overseas to India or to Moscow or wherever it's destined that night. And now, lately, we've had a lot of people who are they call them money mules, who are actually receiving money in the mail or through Western Union or through other means, who actually collect the money and then they wire it overseas themselves, so that the victim is no longer being told to go wire the money overseas and not having the transfer cut off by Western Union or by the bank or whoever. Now the scammers are telling people, if you want to collect your multi-million-dollar sweepstakes prize, go to Harris Teeter on US 15501 and buy $3,000 worth of gift cards. And then when you get out into the parking lot, we want you to read the numbers off the back of these gift cards. And by doing that, by getting this victim to do that, the scammer has access to all the money on those gift cards instantly. And so you may well actually see somebody in your favorite grocery store or CVS pharmacy with a cell phone to their head, and they're in front of one of these big displays of these gift cards, and they're just buying them up, $500 gift card after $500 gift card. Or you may see them at the checkout line. Please try to intervene if you can, because I can assure you that that person is being ripped off in a major way. And a lot of times these stores have employees who are trained to intervene on their own as well. But please don't do nothing if you see that. Use your best, most persuasive voice, as calm as you can, to let them know that they're probably being scammed, because no legitimate company or government agency ever requires you to buy gift cards and read the numbers off. The home repair scammers and the driveway paving scammers, they usually get a check from their victim. Sometimes they will get the victim to accompany them to the bank to take the money out in cash and bring them cash out to them in their pickup trucks in the parking lot. But usually it's a check. They sort of browbeat them or scare them into paying lots of money for a lousy paving job. And then they go straight to the bank and cash it. And so here you have a picture of a Hillsborough paver named Jimmy Stevens. There are several Jimmy Stevens pavers up in Hillsborough, but this particular one, we had a court order banning him from doing any driveway paving. And here he is cashing one of his driveway paving victims' checks at a state employees credit union right after we got that court order. There's one thing about the elder fraud industry is they really are very adept at locating and exploiting people who are in the early stages of certain forms of advanced cognitive decline, things like Alzheimer's disease, Parkinson's, multi-infarct dementia, the sorts of problems or diseases that actually cause a fairly rapid decline in cognitive abilities. And one of the first things to go when you're in this progression, whether it's normal cognitive aging or Alzheimer's, one of the first things to go is your capacity to handle your finances in a way that's consistent with your self-interest. In other words, you're not able to protect yourself against scams anymore. And that's part of the definition of financial capacity, or financial competence, as it's called. And the reason this kicks in prior to other forms of incompetence or incapacity is that when you're dealing with finances and financial decisions and doing financial calculations, that's a very abstract mental process that you're engaging in. And if your brain is starting to deteriorate from early Alzheimer's or some of these other problems, that's what's going to go first. And so the scammers, they are actually looking for this as hard as they can. They actually can go on the dark web and get lists of people who are taking Alzheimer's medications or medications for Parkinson's, people who've just been diagnosed. And they will call those people and start telling them they've won some big prize, knowing that their financial capacity is likely to be impaired. If you're familiar with the progression of Alzheimer's, you've probably heard the clinicians talk about early Alzheimer's or preclinical Alzheimer's, which is usually pretty asymptomatic. There's not very many outward signs that's happening. And then there's mild cognitive impairment, where you actually can see pretty easily what's going on. And sometimes it's not that subtle either. You can actually see that mom or dad is having these tremendous problems. And then there's the dementia stage, the fully expressed Alzheimer's disease. And there's no real need to go into that too deeply. But in the Alzheimer's progression, it's very interesting in that even at the earliest stage, the asymptomatic stage, financial capacity is significantly impaired. People are starting to have trouble making financial decisions, or discerning that something's a scam. Had they been hit with this pitch 5 years earlier, they would have blown it off, they would have hung up the phone, but now they're on the hook and they're going with this scammer. With mild Alzheimer's disease, the middle range, financial capacity is impaired as well. Impaired in almost every activity that you could engage in financially. And then when it's moderate stage Alzheimer's disease, the middle stage, there's severe impairment there. And that's very scary, especially if you know that 1 in every 4 people aged 70, 78 or older is in the early stages of Alzheimer's disease. Almost 1 out of every 2 people at the age of 84 is in this condition. And 1 out of every 7 people who has this disease lives alone. So they are very much at risk from being exploited by the elder fraud industry. When we were dealing with these repeat scam victims, some of whom we just couldn't talk out of dealing with the fraudsters, we would have to get the family involved or sometimes the courts involved. They would often seem totally normal, other than their desire to do business with these scammers. And a lot of times we would say, well, take your mom or take your dad to the geriatrician. Next time ask for a cognitive assessment when he goes in, just to see how things are going with him cognitively. And the usual response that came back from the family was, well, Dr. So-and-so gave a screening to dad last week, and the results were the normal cognitive aging. He's really not got that many problems. But then 2 or 3 years later, we would get a call from these same family members. They would say, Mr. Kirkman, mom or dad just came back from the doctor today, and the diagnosis was they have Alzheimer's disease. They're in the middle stages of Alzheimer's disease. And this is a pattern that we could see over and over again with a lot of our victims. They seem totally normal. The screening that the doctors would do would come back negative. But then a year or 2 later, sometimes 3 years later, boom, here comes the diagnosis. They have Alzheimer's. It wasn't across the board by any means, but it happened a lot. And it just seemed to be, an A to B relationship. Last year, back in May of last year, this study comes out from Rush University Medical Center in Chicago, which is a very prestigious place. And it talks about a big research project they did with people in this age group that we're talking about. And they studied them over many years. And one of the things they noticed among several people was there was this reduced scam awareness. That was the phrase that they used, reduced scam awareness among many of these people. And as the years went by, a very high percentage of these people who had reduced scam awareness, they were suddenly unable to perceive that they were being scammed or they were in a dangerous scam fraud situation. As the years went on, these particular people were far more likely to be diagnosed with Alzheimer's. So there was, as of last year, this past spring, a year ago, there was scientific confirmation that appeared that, yes, this is a telltale sign of somebody who's repeatedly being victimized by these scammers. They're super victims or mega victims losing $100,000. This is a very high likelihood that Alzheimer's disease is lurking there and is going to be present and be diagnosed within a year or 2. And that's part of what this project says. The time frame was basically 1 year. So there are several other studies that talk about damage to particular lobes in the brain, areas in the brain. Some of them can cause you to believe things you normally wouldn't believe in the past. You become more credulous. There's also another area of the brain that's been studied. If you have damage or deterioration in that part of the brain, your ability to perceive dangerous situations goes away. You might actually get in a car with somebody who's very unsavory looking, that sort of thing. There's also research that shows that as people age, they go through this age group, instead of being conservative with their money, they actually take more risks with their money. And this is something that was researched by AARP back in the late 90s. And it's something that has been borne out over and over again. And they link it to deterioration of various parts of the brain. And so now there are lots of scientific studies, physiological studies going on to actually link a lot of the victimizations to the elder fraud industry to these various problems with decline in cognitive abilities to physical deterioration in the brain. So that's probably the scariest part about all this. And the elder fraud industry, which is a multi-billion-dollar industry and growing very fast, and as we saw spread all across the world, is becoming more and more adept at finding people who have these problems. And they are really having a field day, I'm told, now that so many of us are at home because of COVID-19. That one vulnerability that we talked about earlier that has nothing to do with Alzheimer's, the vulnerability of being alone and being isolated and not having your friends at close hand, your support group, basically. This is making it very easy for all of these scammers to prey upon our older friends and neighbors and our older loved ones in this time where we're dealing with the horrible health crisis. So with that, I think I've maxed out my presentation, but I'd love to hear any questions that any of you might have about this. A couple of comments.
Some older ones. Let's see. I don't know if anyone has questions. It's interesting because we've had in our church recently, someone has been, I guess, spoofing the email address of our pastor and sending people requests for gift cards. And so we've had to, the church has had to keep putting out statements. Look, the pastor's never going to ask you to go buy, Amazon gift cards at any point.
Yeah.
And we'll even sometimes at work, it'll usually end up in the spam folder, but there'll be some that will spoof Dennis's email, and it'll say, hey, do you have time to do an errand for me? And what it is they're trying to get you on the hook, thinking it's your boss sending you out to get gift cards, which, obviously Dennis isn't having us run out to get gift cards. All right. Andy says, thanks for the work you've done and continuing to pass along the important info.
Thank you, Andy.
So
the churches are subject to a lot of scams too. There was at one time a special unit in the AG's office that dealt with church scams, and a lot of them started out as phone scams. Somebody's coming down to Pittsburgh to join this church and move into a house in Pittsburgh, and all of a sudden they're in dire straits up in South Hill, Virginia. Their car's broken down and they need $800 from somebody. Can the pastor please wire $800 to this name and address in South Hill, Virginia? And that was a pretty rampant scam for a long time. But now they're doing just what you described, where off the dark net, they've bought all these email addresses for churches, or it could be companies, it could be Rotary clubs, and they'll send these alarming emails to various members of the group, members of the congregation, saying, I'm Pastor so-and-so, can you help me with this problem? Can you wire money to this person? Can you go buy gift cards for $3,000 and read back or send me the numbers off the back? It's pretty rampant even in the church communities, all these scams that are out there.
Yeah, and I imagine too now that a lot of, I know our church, we're not planning to have in-person services for quite some time, just for safety. But I imagine, taking advantage of the fact that people aren't necessarily seeing their pastors in person so much anymore. And so that where you usually might be able to just see them face to face and check in, that's certainly a concern. If someone gets one of those phone calls, like with the grandparent scam phone calls, what's one of those steps what are the steps that they can take to think about in that moment where they might be like, oh no, my grandson is not doing okay. What should they do in that moment to help kind of regroup and sort of question the situation. How can they verify that their grandchild is okay? What are some steps that they can do to make sure they don't get tricked on that one?
The first thing to do, and oftentimes people won't do this, is they need to stop and step away. Just put the phone down and walk to the other end of the house for a moment and think about it. And then they need to call the grandchild themselves. And the thing about these scammers, they're smart. They'll say, don't call the grandchild back. Or if it's somebody pretending to be the grandchild, they say, don't call me back. I'll get in trouble with the jailer if I get a call on my phone. So don't call my phone number back. I'll call you. And so what they're trying to do is keep the grandparent from calling granddaughter or grandchild. And so to get around that, the smartest, best thing to do is just to call the grandchild. And when we've had victims on the phone with us, they tell us, I can't call him. He'll get beaten up in the jail. And we say, well, let me have his phone number so I can just check, make sure the cell phone is there in Cancun, Mexico, or Pensacola, Florida. And then I will call the grandson. I will call him and find out that he's in class at Appalachian State as we speak. And please call your mom, grandson, or call your grandmother. She thinks you're being held in jail. And usually that stops you right away.
And so that's probably also a lesson to grandkids to pick up the phone when their grandparents call, just in case, so that the grandparent knows that they're doing it.
Grandparents and grandchildren both need to get each other off their social media sites. And, I mean, even if you're proud of your grandchildren, they're doing well in college or in high school, get it off your Facebook page, unless your Facebook page is only visible to friends. Because scammers they're out there screening everybody's Facebook page, the other social media, and they will, like I said, the grandparent scams are done by the Russian mafia and by the motorcycle gangs, and they do really good research on you, on your grandchild, and then they hit you. They're going to make it seem very real.
Yeah, no, that's definitely important if you're on social media to know what the privacy settings are. And maybe at some point, and I'll talk with Jackie about this, maybe at some point we can do a little seminar for folks just to show them how to check on their privacy on social media and see what they're posting and where. People have a tendency to put a lot of information very, very publicly. It might be even something where you have your Facebook page. I'll just show myself since I keep talking so much. Where you have your Facebook posts private, but then you're going on to another part of Facebook that's not private. For instance, if you post on the Council on Aging's page and you write about your grandkids and their names and their ages and you post their picture, well, everybody's going to see that because we have a public page. So if you come into a public space, just like if you went out into the public square and shouted it out to everybody, hey, my grandson is such and so, and here's his picture, you have to think that you're sort of doing that same thing there. And so if anyone has questions about their privacy on Facebook or other social media, I'm happy to help, and we can certainly do that. And really just kind of check in and make sure on Facebook that you know the people you're adding, and don't just assume, well, this person, it says they're friends with my other friend, and so I'll add them. Sometimes you get people who are fake profiles who are adding your friend, and your friend just adds them. And you think, oh, well, my friend added them, so they're my friend. There's so many fake profiles going around. I get a bunch. I was widowed young, and so very early on got a bunch of the fake profiles. Fake dudes coming in. I don't know who's let me back either. And so you get these fake guys, and it'll be, a lot of times it'll have like a combo of an American name and then a non-American name, and just a bunch of things, a lot of things that you'll see sometimes on Facebook with these guys. And they usually are, I think women are getting these posts the most, and they'll have like either like sweet little sayings or pictures of themselves in a military uniform or pictures of themselves in whatever, and they go around sort of preying on folks. One of the things I've noticed, one of my friends, Salem, who was actually on the same day you were, David, on the first Listen and Learn-a-thon, she has a whole Facebook photo album of all of what she calls the bachelors, with scammers that she gets, and maybe one day we can have her come on and share that. But a lot of times it'll be like names that just would really not be, be like George will be their name or something like that. So anyway, just if you don't know them, don't add them.
We tell people to do some of these programs where you can check where a photograph came from. If they have one of these online boyfriends, because a lot of times it's going to be just a stock photo from someplace, or it'll be some French guy who's married happily and living in southern France. It's not who they pretend to be at all. And that usually bursts the bubble of the romance scam right then and there.
Does anyone else have any questions, comments, thoughts? Anything that they've seen come through that they might want to tell other people about, that they didn't fall for, but they wanted people to know is out there that they've seen recently? I don't know. I know one of the things had that thing with the press one calls. It's a little tricky because we have functionality now on Zoom with folks to where we can call out and they press one to join the Zoom call, but we try to let them know what time and when and what. And so, but I know that but if they ever feel uncomfortable with it, they don't have to answer. All right, so Andy mentions a computer support scam. Is that something you're kind of familiar with, people who try to offer their computer support?
Yeah.
Oh, here it says, my dad had them call me once since I did all his support. We actually taped a note in my handwriting on his computer not to answer any of these calls. There you go.
Did it work?
I don't know, I hope so.
I kind of glossed over the tech support scammers. That, they're part of this whole industry over in India that does a lot of these fraudulent calls. Usually start out as live calls instead of robocalls if you're doing a tech support scam. But I've actually had several cases where people were scammed by the tech support guys. And not only did they lose a lot of money and have everything about their finances exposed to the dark web, but they became just physically impaired and physically ill. They were so upset with what happened. And a lot of these folks are, just as we described earlier, very high functioning. But these particular tech support guys, some of them are fairly clumsy, but a lot of them are very, very good and very convincing that they're the person you dealt with a couple of years ago when you set up your computer. And they will get you for unbelievable amounts of money. And so my next door neighbor in the AG's office, the woman in the office next to me, her dad fit that very profile. He was so distraught by having been scammed by these people that within a couple of weeks he was in a nursing home, and a few weeks after that he passed away. And it was all linked back to his distress over this incident. And so I think they're some of the most insidious ones out there because they're so sophisticated.
That's upsetting. And so Andy said that it did work. That the father had them call him instead. And he said some rather interesting calls claiming to be from Microsoft. Yeah, right.
Yeah.
That's the thing. I mean, you could probably, if you know enough about your computer, you could talk them around in circles if you wanted to, but better to just hang up.
Yeah, it is. Or you tell them you have a Linux computer, you don't run your computer system on Microsoft.
Yeah. And don't let someone call up and then, offer them access into your computer, because there's ways that people can access your computer remotely. Don't give other people access to your computer remotely.
Yeah, this is another good one for a lot of public awareness, just the different ways that they're going to insinuate themselves into your mind and into your computer, because just knowing what's coming helps a lot of people to avoid being scammed.
For sure. Anyone else have questions, comments, thoughts? If someone wanted to get your copy of your book, I know we kind of mentioned that in the Listen and Learn-a-thon, but we have some different folks probably watching today. If they want to get a copy of your book, what's the best way to?
This book?
Yes.
All they have to do is Google the title, Elder Fraud Wars. Now on my screen, this is showing backwards.
We can see it correctly, yeah.
It's Reddit Schwa. Elder Fraud Wars. Just Google Elder Fraud Wars, and a lot of sources, booksellers will pop up, including the publisher, McFarland Publications. But Google and Amazon, see Target, a bunch of others carry the book, and you can also get it through e-reader services like Kindle. And it's a really good, it has a nice tight feel about it, and it really shows how these scams are hitting all across North Carolina, all across the country, and even around the world, because this really is a global industry that's getting people.
That's the thing, you know, as we become sort of more connected, and it's just easier to get a hold of people and find people and get information. It just makes it just that much more important that we kind of stay on top of it. All right, well, if no one else has questions, I guess I'll thank you for joining us. I think Jackie might be back on, so maybe she could do her little brain break. I don't know, she's got her, are you there, Jackie?
I am.
Okay.
So I can do a different kind of brain break.
All right.
All right. David, thank you so much. I had a friend of mine who was in his 90s, and he had someone, he was very, very sweet gentleman. He would help anybody. And I found out like a month in that he had had some woman stop at his house and needed money, and he gave it to her because she really needed it. And by the time he was done, he was out about $10,000 because he was embarrassed to talk to me about it. And then I was there, and we called the police department. You know, I said, no, we've got to put an end to this now. And so it broke my heart because he really wanted to do the right thing by people. So thank you for doing what you do.
Glad to do it. Glad to speak to all of you. And Krista, I'm really impressed you've been able to stay out on the front porch of the Council on Aging the past 3 mornings, and you haven't broken a sweat.
Yeah, I tell you what, it's magic, the magic of technology. Very good. Thank you so much, David.
Sure.
All right, Jackie, I don't see if your camera's not on yet, so.
I just turned it on.
All right.
Do you see me?
Mask? Not yet.
No, I am outside, so I am mask free.
Okay. I just see a black screen.
Oh, you just see a black screen? Oh, mine shows. Oh, you know what? I bet you I came on without video. Let me see if I can.
All right.
Well, the one I was going to do is not when you need to see me. So this is perfect.
So we'll just see.
I don't know how to change. Let me see if I can. Hold on.
I could just show the front porch of the Council on Aging like magic like that. Would that work?
I just don't understand. When I came on, I don't know whether I came on without video. I may have come on without video. If so, I apologize. Is there a way I can change that now?
What if I stop it and then you try to restart it?
Oh, hold on a minute. Try. It says you cannot start your video because the host has disabled it.
Okay, well, I'll ask you to start it now.
All right. Now can you see me?
This is why they pay me the big bucks. All right.
The big bucks.
I just see a black screen, Jackie. I mean, if you want to, I mean, we could I could put up a nature photo. You want to?
A nature photo is fine.
Okay.
For what we're gonna do.
Okay, I'm gonna first just make it like we're looking at the porch while I find.
That's fine.
Photo.
Well, this is going to be. This is only going to be a few minutes, so.
Would be the beach.
Beach is great.
There we are. We are at the beach, y'all. And this ticket was free. All right, so go ahead, Jackie.
So everybody, we're going to take a little bit of time and be mindful. And mindful is just about being in the moment. So as you sit in your chair, if you want to stand up, you may, either way. So what I want you to do is, if you have a drink in front of you, I want you to hold the drink in your hand. And I want you to look at the container that your drink is in. What color is it? Notice, I want you to pay attention to the colors. The color of the cup, the color of the bottle, whatever it might be in. And take in the colors. What do the colors remind you of? Do they bring back any memories? If it's blue, does it remind you of being near the water? Is it green? Does it remind you of being in the woods? Now go ahead and, if you can take the top off, or you can look at the color of the beverage. Look at the color of the beverage and just take in the nuances of what it looks like. Maybe it's bubbly, maybe it's not. Maybe it's frothy, maybe it's not. Maybe it's clear, maybe it's not. And if you can tell by the outside of the cup, feel the outside of the cup, and is there a temperature change between the outside of the cup and the air around your hands? And just pay attention to that feeling of the temperature. As you're feeling the cup, is there any texture to the cup, the bottle that you're holding? Does it have contours? Does it have any raised area on it that may be a design? Was it a special gift from somebody? Was it something you bought for yourself? Pay attention to just the way the cup feels in your hand. Now go ahead and hold up the cup and bring it to your upper lip, but don't taste it yet. And just go ahead and smell it. Does it have a smell? Does it smell good or sweet? Does it smell tart? Does the smell invoke memory? Smell is an amazing sense that brings back to certain places, just like music can do the same thing. So look at so smell it. And now go ahead and take your first little sip. And as you take the sip, hold it in your mouth. And what is the temperature of the liquid compared to the temperature of your mouth? Is it warm? Is it cold? Is it room temperature? Feel it in your mouth. Notice how the temperature adjusts to the temperature of your mouth. And then go ahead and swallow it. What do you taste after you swallow? Is it sweet? Is it tart? Was it bubbly in your mouth? And notice how far down the flavor goes into your body. Feel it down your throat, into your stomach if you can. Pay attention. Take another sip and do the same thing. Notice the smell, notice the taste, notice the temperature as you swallow. This is just a very simple, detailed way that you can be mindful. And being mindful is important because it can help break the feeling of tension in your body, because you're taking your brain away from items that it's working on and making it pay attention to the moment. When I used to work with residents with dementia, in some respects, I was envious of them because they only had the moment that they were in. They weren't worried about tomorrow. They weren't thinking about yesterday. They were in the moment. So I want you to concentrate today on staying in the moment. And if you do get stressful, just go ahead and breathe deeply, especially after hearing about all these scams and how we need to be careful. Being stress-free is one way that we enable our brain to process things better and to be able to avoid problems, because we're making clearer decisions, because we're not having our brain working on all kinds of other things. So I hope you enjoyed this, and I hope you decide to come to some of our exercise classes or tune into some of our other programs. We're glad you were here. Krista, back to you.
Help if I unmute myself. Thank you, everyone. I'm glad that everyone was able to join us. I hope that you enjoyed this conference. Nancy sent me the copy of the poem, so I'll get that out to you guys. I'm working on trying to get the recordings of the videos pulled together. I hope to, hopefully sometime next week, send out, for everyone who had a ticket, send out a copy of the recordings for these sessions. Thank you again for your support. Thank you again for joining us. If you want to know more about our other activities that are coming up, you can always check our website, chathamcoa.org. And we hope that you have a wonderful rest of your day and a great weekend. Thank you, everyone.